three dhatus. One is a precursor of Rakta, that is Rasa, the actual Rakta, and the next successor dhatu is Mas. So while supporting a lung cancer patient, we should keep in mind Rasa dhatu, Rakta dhatu, and Masa dhatu. So, in my view, to understand or to support a lung cancer, we should consider the treatments of Rasa Pradosha Vyadhi, Rakta Pradosha Vyadhi, and Mamsa Pradosha Vyadhi. Means these three Pradosha, three dhatus, structural damage, Rakta dhatu is structurally damaged, and that can be supported, that can be repaired, or we can support the proper functioning and proper structuring of the Rakta dhatu through proper logistics, that we can say Rasa dhatu, the actual Rakta dhatu, and the Mamsa dhatu. So in that way, Rasad Raktam Tato Mamsam Mamsan Medo Prajayate, if we want to properly channelize this hierarchy, then we need to work upon Rasa Pradosha Vyadhi or Rasa Pradosha Vyadhi Chikitsa, that is Langanam, lung cancer patient. And if we want to really support the lung cancer patient, then our treatment goal should start with Langan therapy, autophagy, and that will help the patient's initial stage, that is initial support, by removing obstacles of ama into the lung parenchymal tissue. That ama removal, along with Rasa Shuddhi by Langan, that has been depicted by the Samitaka, we will achieve a good quality of Rasa dhatu. And that good quality of Rasa dhatu is the basic logistics for the Rakta Agni. Rakta dhatu Agni will get a proper good quality Rasa dhatu. Then it will work upon the Rasa dhatu, and Rakta will be prepared properly, and the production of Rakta dhatu from the Rasa dhatu, there will be a Prasad bhag, there will be a actual dhatu, and there will be a Mala, Pitta bhag. This Prasad bhag will produce Phuphus, because Shonita Phena Prabhavaha Phuphusa. And Phen is supposed to be a Prasad bhag of anything. If it is milk form, then also is a Prasad bhag of milk. And for Shonit Phena means Rakta se Prasad bhag. तो रक्त के प्रसाद भाग से फुफ्फुस की उत्पत्ति होती है, और रस के अच्छा रस मिलेगा, लंघन के द्वारा आम पाचन होके अच्छा स्वच्छ रस मिलेगा, अच्छा रस मिलेगा, तो रक्त धात्वाग्नि उस पर काम करके उसमें से प्रसाद भाग रूप रक्त धातु उत्पन्न करेगा, और वो प्रसाद भाग रूप रस रक्त धातु वो लंग पैरेंकाइमल टिश्यू की उत्पत्ति करेगा। लंग पैरेंकाइमल टिश्यू प्रॉपर कैसे बनेगा? जो बिगड़ा हुआ है उसके लिए वो लंग पैरेंकाइमल या लंग के सेल में जो बीजभाग अवयव है, वो जो सूक्ष्म भूत है, मन है, वो सब सच्चे अच्छे रक्त को लेके, प्रसाद भाग को लेके उसमें से नॉर्मल लंग टिश्यू को बनाएंगे। अभी प्रॉब्लम क्या है लंग कैंसर में? जो लंग टिश्यू है वो अपना काली की स्मृति को खो बैठा है। जो टाइम का उसको शेड्यूल दिया हुआ है कि तुमको पैदा होना है इतने दिन तक रहना है, फिर नए दूसरे सेल को पैदा करके मर जाना है। ये जो काल की स्मृति, या तो उसका जो कोडिंग उसके पास है उसके सेल के बाहर, वो इरेज हो गया है। इसके कारण वो खुद को इमॉर्टल जैसा समझ के नए नए सेल पैदा करता रहता है और खुद भी नहीं मरता है। ये प्रॉब्लम इज द बेसिक fundamental problem in cancer of any particular organ on a very first hand prima facie understanding of cancer. So when we want to do something good to the cell of particular deha parmanu of lung या तो फुफ्फुस, then we will have to provide proper precursor dhatu, that is rasa dhatu. Then we will have to work upon the बीजभाग अवयव, धात्वाग्नि परिणाम कर भाव, आहार परिणाम कर भाव मीन्स रक्त आहार परिणाम कर भाव मीन्स रस परिणाम कर भाव. That also will have to be considering in treating a lung cancer or supporting a lung cancer patient. For this proper dhatu vyuhan, we need to do ampachan, that is rasavasrota dushti, then rakta pradoshak vikar treatment, and rakta pradoshak vikar treatment modalities are advised as rakta pitta harim kriyam, virechanam upavasascha, shravanam sronitasya cha. So if we want to support a lung cancer patient, we will have to first of all do ampachan, then we will have to consider the rakta pitta chikitsa, then virechan and shravanam sronita, that is rakta moksha. These are the treatment modalities to produce proper logistics for rasa dhatvagni, rakta dhatvagni, that is proper ras. Second thing, to produce proper rakta dhatu, that requires rakta pradosha chikitsa. Rakta pradosha chikitsa, rakta pradosha vyadhi chikitsa is rakta pitta harim kriyam, virechanam upavasascha shravanam sonitasya. This has been depicted by Charaka in the Shonita Roga, Vidhi Shoniti. Kuryat Shonita Rogeshu Raktapitta Harim Kriyam, Virechanam Upavasascha Shravanam Shronita. So, this treatment modality is prescribed for Raktapitta, Virechan, Upavas. We already have executed as Ampachan in the Rasvasrutodushti Chikitsa and Shravanam Shronita. So, providing proper logistics, proper precursor dhatu, that is rasa, then rakta will work upon the rasa to produce proper rakta dhatu, normal rakta dhatu cell, और उसका भी प्रसाद भाग जिसमें से वो फुफ्फुस बनेगा. फुफ्फुस को जो रक्त मिलेगा वो उस पर फुफ्फुस के बीजभाग अवयव, मन और वहां आहार परिणाम कर भाव, जो 6 आहार परिणाम कर भाव है, वो वहां उसको ठीक करेंगे. वो 6 आहार परिणाम कर भाव आपको गिना देता हूं. वायु है, स्नेह है, ऊष्मा है, काल है, क्लेद है, संयोग है. हो गया ना? हाँ, तो वो 6 मिलके लंग पेरेन्काइमल टिश्यू को नॉर्मल लंग पेरेन्काइमल टिश्यू बनाएंगे. तो वो जो स्मृति भ्रंश हो गया है और गलत लंग टिश्यू बनते हैं, वो बनना रुक जाएंगे. गलत लंग टिश्यू बनना रुक जाएंगे. वो कैसे रुकेंगे? क्योंकि सही लॉजिस्टिक मिलना शुरू हो जाएगा. त्यागाद विषम हेतूनाम समानाम चाप सेवनात् विषमा नानुबद्धन्ति. जो सम रस धातु, अच्छी रस धातु मिलेगी तो अच्छा रक्त धातु बनेगी, अच्छी रक्त धातु बनेगी तो वो खराब रक्त धातु है उसका सपोर्ट बंद हो जाएगा। विषमा नानुबंधनती, उनको अनुबंध नहीं मिलेगा, उनको सपोर्ट, लॉजिस्टिक सपोर्ट नहीं मिलेगा, तो वो बंद हो जाएंगे और वो अपने आप क्षीण हो जाते हैं। स्वभावो परमस्तदा, दिस इज द प्रिंसिपल। लेकिन कैंसर में होता ये है कि ये रसाद रक्तम ततो मांसम वाली जो हायरार्की है उसको बाईपास कर जाते हैं। वो अपना खुद का रसाद रक्तम अर्बुद के रसगुण रस रक्त मांस में अलग से बनाते हैं, न्यू एंजियोजेनेसिस, कार्सिनोसिस, वो सब बनाते हैं। तो उसके लिए आपको व्याधि प्रतिनिक विष भी शरीर की जो रूटीन पैटर्न है उसको बाईपास करके व्यवाही और विकासी आशुकारिता से अपना काम करता है। मीन्स विष, वो विष को सपोर्ट करता है। इसलिए ये आज टोबैको के लिए जो दिन है वो टोबैको विष है, वो लंग पेरेन्काइमल में विष प्रक्रिया को शुरू करता है। तो लंग पेरेन्काइमल टिश्यू पूरी रूटीन रसाद रक्तम ततो मांसम वाली जो फिजियोलॉजी है उसको बाईपास कर देता है, अपनी खुद की पैथोलॉजी, फिजियोलॉजी सब डेवलप करता है, वो बहुत फास्ट डेवलप होता है। तो उसके लिए विषघ्न औषध, विषस्य विषम औषध, उसकी यूटिलाइजेशन करना बहुत जरूरी होता है। ये हर तंबाकू है। वैसे एक बात मजेदार है, ये बताना मैं चाहूंगा कि देयर हैज बीन नो साइंटिफिक एविडेंस दैट टोबैको और स्मोकिंग प्रोड्यूस कैंसर। Of course, smoking has been proven to produce cardiovascular problems or cerebrovascular problems, but yet to prove that it is an cause or a causative factor for cancer. But even then, coincidental or incidental researches do support this, that smoking has a role to play in production of carcinogen. So, in that way, to combat the Jangam wish, that is bio wish, we need to use Sthavar wish, and for that we need to use Rasa Yogas, which are the best Vishagna Dravyas utilized in such a way that they can produce something positive results in the body. So, Rasha Shastri's claim like that Mratani Lohani Rasibhavan. So, when we want to produce a proper Rakta Dhatu and proper lung tissue, we need to use Visha, and that also purified Visha. For Urdhva Bhag of the body, when we want to do something good with a Visha, then Hirak has been claimed to be quite effective, and usually people use it. And for me and my Sadguru Manantanante, we have been using Hirak Bhasma with Chatushashti Pipali, Shangarabhrak and Shrung Bhasma. It's a combination to dilute the not dilute, to fix the dose of Hirak Bhasma, because 1/64 रत्ती वो उसका डोज है, वो ये श्रृंग श्रृंबराव्रत सीतोपलाजी और चतुर्शती पिपली के साथ मिला हो तो ही एडमिनिस्ट्रेबल या तो डिस्पेंसेबल हो. सो वी यूज हीरक भस्म And Hirak Bhasma is also of two types. One is black and another is reddish, which is very famous and common. The reddish one gets prepared through Makshika, and black one is prepared from Manduk Mutra, which is very rare, but my Sadhguru has an grip over it. So she produces ample amount of Manduka Mutra and then Nirva of Hiraka Churna and then preparing Bhasma in Kapot. So this is the blackish Hiraka Bhasma. And that blackish Hiraka Bhasma is mixed with Sitopaladi, Shungrab, Shungrabrak or Shung, with Chatusashti, of course, and then administered with honey and what do you say, butter. So that attacks the wrongly formed lung tissue. It destroys the wrong, जो बिगड़े दिल शहजादा का सेल होता है उसको वो खत्म करते हैं और प्रॉपर लंग टिश्यू, वो खराब लंग टिश्यू को खत्म करना है और उसकी जगह, वो जो जगह पड़ेगी वहां नए अच्छे सच्चे लंग टिश्यू को एस्टैब्लिश रिस्टोर करना है. इस तरह से ये मल्टीफैक्टोरियल एस्पेक्ट से रसाद रक्तम तो मांसम, ये हायरार्की को एस्टैब्लिश करना है और वो कैंसर की गलत हायरार्की बन गई है उसको वो विष जो बाईपास करती है उसको विष से ठीक करना है. तो हीरक को इधर यूज करना है. हीरक वो जो गलत लंग पैरेंकाइमल टिश्यू है उसको डिस्ट्रॉय करता है और खुद विष भी है और रसायन भी है. रसायन तो हम बनाते हैं, उसको होता तो वो बेसिकली विष ही है और वो रसायन के साथ हम उसको देते हैं रस, लंघन, रक्त पित्त हरि क्रिया और मांस धातु को ठीक बनाने के लिए पंचकर्माणी पैसे. तो ये सब मिला के हीरक, चतुष्षष्ठी पिपली, शुंगराभरक भस्म, शुंग भस्म, ये ओरल, शिरोधारा, अभ्यंग, आस्थापन और अनुवासन, ये पंचकर्माणी पैसे जब वो मांस धातु की और रक्त धातु के लिए रक्त पित्त हरि क्रिया, विरेचन, उपवास और श्रावण सोई. ये इतने पूरे उपक्रम को एक साथ मिला के सेट करके उसको हमने पिछले 22-25 सालों में मिनिमम 8-10 हजार कैंसर के लंग के कैंसर के पेशेंट है तो बहुत सारे 37,000, लेकिन कोई माने भी नहीं इतना सारा होगा. लेकिन ये सिर्फ 8-10 हजार तो लंग के कैंसर के पेशेंट को हमने सपोर्ट किया है, फायदा दिया है. 30-40% तक का फायदा. अरे पवन जी आप बंद करिए या तो फिर सुनिए, मुझे हंसी आती है क्योंकि मेरे एक वेबिनार में एक भाई साहब यूं करके अपने तौलिए से पीठ पूछा रखते और सुन रहे थे. ऐसा ही हो रहा है आजकल अभी. तो मैं कहने का मतलब ये है कि इस तरह से विष की औषधि, ये जो मैंने योग बताया वो जो पंचकर्माणी भैषज मांस के लिए उसमें अमृत कर्म बोलता हूं उसको, उसमें अभ्यंग, स्वेदन, शिरोधारा, आस्थापन और अनुवासन हर रोज करते हैं 21 दिन तक. और साथ में ये उसी वक्त रक्तपित्त के जो जाने माने योग है उसको यूज करते हैं. प्रमथ्या हमारे यहाँ वो ज्यादा यूज होती है, रेबेरादि प्रमथ्या, वो चरकोक्त रक्तपित्त की चिकित्सा है. उपवास वो हम इंटरमिटेंटली करवाते रहते हैं, हफ्ते में 2 बार गर्म पानी पर उसको रखते हैं, कुछ नहीं खिलाते और जरूरत लगती है तो ऊपर संधि में से रक्त मोक्षण भी करते, लेकिन वहां तक नहीं पहुंचना पड़ता। लेकिन ये पंचकर्माणि भेषज, रक्त पित्त हरिक्रिया और ये विषयोग, इतने कॉम्बिनेशन से हमने लंग कैंसर के पेशेंट को सपोर्ट किया है। जो आज का टोबैको का सब्जेक्ट है, वो धूमपान है, वो हम किसी को भी बोलो कि तुम स्मोकिंग छोड़ दो तो वो कोई छोड़ नहीं सकता, आपको उसे कुछ ऑल्टरनेटिव देना पड़ता है, वो बिना टोबैको का। तो उसके ऊपर भी हमने काम किया था। हरिद्रा और अर्क क्षीर के साथ मिक्स करके एक वर्ती बनाई थी, और वो वर्ती को हम धूम के रूप में देते हैं रादर, क्योंकि वो देते थे मीन्स वो एक बच्चे को थीसिस के लिए दिया था, तो इसलिए देते थे बोलते, वैसे तो वो रूटीन है। वो अर्क क्षीर और हरिद्रा की वर्ती बना के उसका धूम वर्ती में रख के धूम देते थे, विकालम पाए तुम 2 बार उसका, और उससे काफी सपोर्ट मिलता था पेशेंट को। और साथ में एक कंटकड़ो, क्या बोलेंगे, तौबा, टेक्कस मकाटा, उसको संस्कृत में क्या बोलते हैं?
तालिश
पत्र नहीं, वो तो सेनमम तमाला है। ये टेक्कस मकाटा, निर्मली, हाँ निर्मली, कथक,
वो तो स्टेगनोस पोटेटोरम है सर।
अब तो वो होगा यार, द्रव्यगुण की जान छोड़, मैं तो फिजिशियन हूँ, वो जो भी हो, लेकिन वो निर्मली बोलते हैं जिसको, वो पानी में डालो तो वो सब कटरा नीचे बिठा देते हैं।
बीज रहते हैं, बीज
वाटर डिसइंफेक्टेंट पे उसका वर्क है।
नहीं, हमारे यहाँ ट्रीटमेंट, वो बिच्छू काटता है ना, वहां उसको चिपका देता है, तो सकट से चिपक जाती है, और फिर वो कटक बीज बोलते हैं उसको,
निर्मली बीज बोलते हैं,
निर्मली बीज, हाँ। अब वो उसका लैटिन जो भी हो, द्रव्यगुण नॉट कप ऑफ माय टी,
निर्मली बीज,
हाँ वो वही, उसको अश्वगंधा को और ऐसी सब दवाइयों का छोटे छोटे टुकड़े, उसमें थोड़ा फ्लेवर, थोड़ा पाउडर, सब मिला के एग्जैक्ट माणकचंद थी ना, ऐसा फॉर्मुलेशन हमने आयुर्वेद से बनाया। तो वो बंदों को वो खाने के लिए, वो जो माणकचंद खाते हैं या स्मोकिंग करते हैं, उसकी जगह वो देते थे। और बड़ी ताज्जुब की बात है, हमको भी समझ में नहीं आया कि इतना अच्छा कैसे रिजल्ट मिलता था। वो 10 माणकचंद खाता है तो 10 ये पुड़िया खाना उसको बोलते थे, और वो 15 दिन के बाद वापस माणकचंद खाए तो उसको बहुत विचित्र लगता था, और फिर वो बंद कर देते। ये स्मोकिंग के लिए हमारे यहाँ अहमदाबाद में वो एक भावसार साहब थे, वो ही वॉज बेसिकली बीड़ी मैन्युफैक्चरर, बट आफ्टर उनका हृदय परिवर्तन हुआ तो उन्होंने निर्दोष करके एक पफ बनाया, और उसमें भी हमने बहुत काम किया। वो उसका पत्ते और वो सब काम, उसके इंग्रेडिएंट्स को रेक्टिफाई करके वो एक पफ बनाया था, और वो बिल्कुल सिगरेट जैसा ही दिखता है, और उसको प्रमोट करने की कोशिश की। लेकिन फिर भी धुआं धुआं तो है ही, विकालम पाए सुतम, ये शास्त्र की आज्ञा है, 2 ही बार धूमपान करना है। अब आप चेन स्मोकर बनोगे तो फिर वो अति धूमपान की जो लक्षण तरक ने बताए हैं वो सब आपको भुगतने पड़ेंगे, और आज के जमाने में वो कैंसर के रूप में आपको पीड़ित करते। तो 2 बार धूमपान आयुर्वेद का हो, या तो ये जो हमने पुड़िया बनाई थी उसको भी एक बार, वो माणकचंद 10 खाता है तो ये 10 खाना है, एक बार छूट जाए फिर सुबह शाम एक बार खाना, बिल्कुल तो बंद कोई नहीं कर। लेकिन सुबह शाम ये जो ऑल्टरनेटिव माणकचंद, जिसको हम सेफ्टी छुटका बोलते, वो खिलाते थे, तो पेशेंट्स वेल मेंटेन्ड विद दैट ऑल्टरनेटिव गुटखा, दैट जिसका हमने छुटका नाम बोला, और उसमें सब आयुर्वेद, लेकिन फ्लेवर बिल्कुल पक्का माणकचंद जैसा ही बनाया ताकि कंज्यूम करने वाले को, कस्टमर को ये फील ना, कंज्यूमर को ये फील ना हो कि ये कुछ हर्बल है या कुछ आयुर्वेदिक है। वरना आपने तो दवाइयों के, आप सब जानते हैं कितने विचित्र टेस्ट होते हैं। तो वो सब ध्यान रख के सब बनाया और वो बहुत ही इफेक्टिव। लेकिन फिर वो मुश्किल क्या हुई कि वो बड़े बड़ी तोपों के साथ लड़ना हुआ। वो माणेकचंद वाले, फिर वो कोठारी, और ऐसों से अपन कैसे लड़े? अपन फिजिशियन पेशेंट के लिए करते थे, जनरल में नहीं जा पाए। लेकिन जितने हमारे पेशेंट थे उसको तो हमने ये निर्दोष और ये सेफ्टी छुटका से काफी फायदा करवाया। ये संक्षेपो ही क्रिया योगो निदान परिवर्तन, उसके लिए ये काम अपना है। और एक्चुअल कैंसर जिसको हो गया है उसकी कैंसर की ट्रीटमेंट भी करनी होती है और उसके लंग को सपोर्ट भी करना होता है। तो उसके लिए मैंने आपको ये सब बताया कि अमृत कर्म, विषयोग, लंघन, रक्त की चिकित्सा और मांस की चिकित्सा, ये तीन फ्रंट पर काम करना है। पंचकर्म में अमृत कर्म करना है, विषयोगों का प्रयोग करना है, और ये सब होके जब पेशेंट शुद्ध और स्वस्थ लग जाए तो फिर उसका रसायन वर्धमान पिपली से, रसोन से, शतावरी से, ऐसे सब क्षीरपाक के वर्धमान से वो भी करते हैं। उसमें एक्चुअली लंग के साथ अगर प्लूरा का इन्वॉल्वमेंट या तो प्लूरल इफ्यूजन या तो ऐसा कुछ उदक व स्रोतस की भी विकृति साथ में मिले तो तृष्णा की चिकित्सा करते हैं। या तो ये वर्तमान पिपली प्रयोग करते हैं, 10, 20, 30, 40, 50, 60, 70, 80, 90, 100 तक पहुंच के फिर वापस आना है। 90, 80, 70, 60, 50, 40, 30, 20, 10, और उसको 500 ग्राम दूध और 500 ग्राम पानी में उबालना है। पानी जल जाए तो फिर उतार के उसमें ब्लेंडर घुमा देना है। फिर एलची, इलायची और शक्कर डाल के टेस्टी बनाना है और उसका 250 ग्राम सुबह, 250 ग्राम शाम, दूसरे दिन 20, तीसरे दिन 30, फिर 40, 40 के बाद पानी बढ़ाना है, फिर 50, 60, 80, 90, 100 और 100 के साथ वापस। ये प्रोग्राम वर्तमान पिपली हमारे यहाँ किया जाता है और उससे प्लूरल एफेक्शंस में, प्लूरल इफ्यूजन्स में अच्छा फायदा होता है। और उसके साथ में अभी मेरे को याद आ रहा है वो यूकैलिप्टस, उसका पाउडर, उसका ऑयल, दोनों को हम मिला के शक्कर के साथ ओरली भी देते हैं और लोकली भी लेप करते हैं। वो यूकैलिप्टस इज सपोज टू एक्सट्रैक्ट एक्सट्रीम वाटर फ्रॉम द अर्थ। ये कॉन्सेप्ट हमने ये पानी खींचने के लिए, शरीर में से पानी खींचने के लिए यूज किया और टू आवर सरप्राइज along with our Ayurvedic treatment, it worked very well. यूकेलिप्टस ऑयल, यूकेलिप्टस पत्र चूर्ण, दोनों को मिला के शक्कर के साथ दिन में 2 बार चम्मच या तो अपने दोस्तों अपने साथ, और यूकेलिप्टस ऑयल का मालिश या यूकेलिप्टस ऑयल और चूर्ण को मिला के उसका लेप एक्सटर्नल, वो प्लूरल एफेक्शन जो लंग कैंसर में रूटीनली मिलते हैं उसके लिए हमने किया था। ये सब बातें आप सब लोगों के साथ शेयर करने का मौका हमारे बहुत अच्छे मित्र पवन शर्मा जी ने, अंचलेश जी ने मुझे दिया। इसके लिए आप सब लोगों का बहुत बहुत तहे दिल से शुक्रगुजार हूँ, बहुत बहुत आभारी हूँ। आप सबके साथ ये जो संवाद हुआ, हम सबका कल्याण करो और आप सबके अंदर विराजमान वैद्य को मेरा प्रणाम है। धन्यवाद। जय हो।
प्रणाम प्रणाम सब, प्रणाम।
जय हो।
आपके ओजस्वी उद्बोधन के बाद तो कुछ पूछने को रह ही नहीं जाता। आप इतने सरल और सारगर्भित शब्दों में बोलते हैं कि फिर वाह वाह साहब।
भाई जो किया है वही बोलना होता है, इसलिए कोई तोड़ मरोड़ या कुछ ऊपर नीचे करने की जरूरत नहीं पड़ती। कहीं भी कभी भी कुछ भी बोल सकता हूँ। ये सदगुरु की कृपा है,
तपन जी,
बहुत बड़ी कृपा है।
प्रणाम जी, थैंक यू,
जी, जय
वंडरफुल।
हो।
नमस्कार जी,
नमस्कार।
वंडरफुल। पवन जी, अगर एक दो सवाल अभी लें, छोटे छोटे एक दो सवाल है जी यहाँ।
वो एंड में ले लेते तो धारा नहीं टूटती सर।
चलो जी, चलो फिर
एंड वो
चलो।
फ्लो टूट जाता है।
नहीं भाई, अगर मेरे वाले हैं तो मुझे पूछ लो, मुझे
डॉक्टर साहब,
अभी यज्ञ में जाना है। हाँ,
अच्छा,
मेरा routine
जरूर
इसीलिए
जरूर सर, जरूर मदन सर, जरूर।
चलो इसीलिए पूछ रहा हूँ। डॉक्टर
है।
साहब, यहाँ हमारी हरीश वर्मा जी है जी, टोरंटो कनाडा से, उनकी दो
जय
सवाल।
हो।
हरीश जी नमस्कार, आप ही पूछिए जी। एक तो है आर्सेनिक के ऊपर, वो दूसरी बलातक के ऊपर। हरीश जी
जी,
अगर हो तो।
डॉक्टर
हरीश
तपन
जी
जी
नमस्कार।
नमस्कार। नमस्कार
नमस्ते नमस्ते, प्रणाम।
सभी आचार्यों को मेरा प्रणाम। एंड डॉक्टर तपन जी, एक तो आपने रस अग्नि या धातव अग्नि की बात की है, वो थोड़ा सा
Yes, sir.
समझा दें कि
अरे
रस
बाप रे,
अग्नि,
वो
अगर
तो
रस अग्नि मांद्य हो तो उसको डायग्नोज कैसे करें, क्या सिम्टम पकड़े कि हमें पता लगे।
रस प्रदोष विकार है ना सर जी। अरुचि, अश्रद्धा, ज्वर से लेके क्लैब्य, पालित्य, फालित्य, सब पूरी हायरार्की है। वो अगर पेशेंट में ऐसी एलिसिट होता है तो रस प्रदोष विकार है, या तो रस धात्वाग्नि का विकृति है, वो आइडेंटिफाई करेंगे। चरक, सूत्र स्थान, आई थिंक यू आर इन आयुर्वेदिक।
हाँ जी, हाँ जी, हरीश जी है आयुर्वेद
ओके,
का।
हाँ। तो सूत्र स्थान के 24वें अध्याय, विधि शोणिती अध्याय में रक्त प्रदोष पूरी लिस्ट है, वहां से आप प्राप्त कर लीजिए और उससे आप आराम से डायग्नोस कर सकते कि ये रक्त प्रदोष, रक्त स्रोतोदुष्टि है या रक्त प्रदोष विकार है, मांस प्रदोष विकार है, रस प्रदोष विकार है। ये सूत्र स्थान के 28 से 27, हाँ 28 में वो सब रेडीमेड अवेलेबल, और वो एलिसिटेबल भी है, पेशेंट में दिखते भी हैं।
और दूसरा
अपार्ट फ्रॉम, हाँ
दूसरा सवाल ये था, जो एक
जी।
रिसर्च पेपर है पबमेड पे भलातक के ऊपर,
हाँ।
और भलातक का एक्सपीरियंस आपका कैसा है लंग कैंसर के ऊपर।
बल्ला तक नहीं, बल्ला तक लंग कैंसर के लिए नहीं यूज करते, किसी भी कैंसर के लिए बल्ला तक हम जनरल में यूज करते। वरुणाधिक वात और बल्ला तक, ये दोनों, और कांचनार गुगुलू, ये तीन चीजें ऐसी हैं जो पूरे शरीर में कहीं भी कैंसर की कोई भी फिनोमिना हो उसमें आराम से यूटिलाइज किया जा सकता है। हम बल्ला तक के फलमज्जा है, उसको पाउडर करके उसको डाइल्यूट करने के लिए थोड़े दूसरे पाउडर, वो सिंपल इनर्ट मटेरियल जैसे पाउडर ही होते हैं, उसके साथ मिला के उसमें बहुत कम मात्रा में बल्ला तक का तेल मिलाते और एक पाउडर बना देते। उस पाउडर को आधा चम्मच सुबह, आधा चम्मच शाम को दूध के साथ हर एक कैंसर के पेशेंट को देते। और दूसरा एक प्रयोग होते हैं जो बल्ला तक का पाउडर हम क्या बोलते हैं, अर्थवर्म को खिलाते हैं, और उसकी जो मिट्टी होती है, वो जो मिट्टी बनाते हैं अर्थवर्म, वो बल्ला तक में से, उस मिट्टी में हम गेहूं बो के उसके जवारा बनाते हैं, व्हीट ग्रास बनाते हैं, इतना माइल्ड करके वो फिर वो व्हीट ग्रास को हम बल्ला तक के रेसिड्यू से वर्मी कल्चर करके उसके व्हीट ग्रास बना के वो जूस पीना तक बोलते हैं, और उसमें भी बल्ला तक का रिएक्शन आता है। लेकिन हाँ, ये हाँ,
एक लास्ट सवाल, जो आर्सेनिक के प्रेपरेशंस हैं, समीर पन्नग,
हाँ,
स्वर्ण समीर पन्नग रस वगैरह, ये
हाँ,
भी काम
हाँ,
करते
हाँ,
हैं।
हाँ। समीर पन्नग रस वो बेसिक स्ट्रक्चर वायु पर काम करता है, और वायु हर एक सेल की आकृति डिजाइन करता है। जो आकृति खराब हो जाती है, हर एक कैंसर नियोप्लास्टिक आकृति हो जाती है, तो वो आकृति को ठीक करने के लिए, वायु का शमन करने के लिए सिंपल बस्ती या सादे अजमोदादी जैसे औषध काम नहीं करते। वहां विशस्य विषम औषधम करके समीर पन्नग है, वात गजान कोश है, ऐसे औषध को, कालकूट भी उसमें अच्छा काम करता है। ये सब मल्ल सिंदूर है, मल्ल, ताल और शिला, तीनों को मिक्स करो तो वो कोविड तक कि लंग के इन्वॉल्वमेंट को मदद देता है। तो वो गर्भाशय कुछ करने के लिए समित पंडित आपने बोला वो बिल्कुल ठीक, अच्छा रहेगा, हमने यूज किया है।
थैंक यू सर।
क्योंकि हमारा हीरक पर ज्यादा जोर है, इसलिए समित पंडित क्या बोलते हैं, असिस्टेंट इंस्क्रिप्शन में होता है, प्रिस्क्रिप्शन में।
चलो हरीश जी, आर यू सेटिस्फाइड?
जी जी बिल्कुल बिल्कुल सर, प्रणाम सर।
थैंक यू।
डॉक्टर साहब, हमारी तरफ से एक छोटा सा सवाल जी। हमारे ये आपने जो बताया 35,000 40,000 जो केसेस है आपके वहां पे, उसके कुछ डॉक्यूमेंटेशन वगैरह है जी आपके?
अरे भाई जंगल है डेटा का।
अच्छा,
क्या कोई मेरे को मिलता नहीं काम करने वाला।
अच्छा, ये
60 का हो गया, सब डेटा वैसे का वैसा पड़ा है।
अच्छा,
डायग्नोज्ड बायोप्सी डायग्नोज्ड पेशेंट की पूरी हिस्ट्री आयुर्वेदिक और अंग्रेजी जो अपन को सिखाई हुई है और मुझे आती है वो।
डॉक्टर साहब अगर
विद
हम
रिपोर्ट्स बिफोर ट्रीटमेंट के जब मैं शुरू करता हूँ वो, और 4 महीने में दोबारा रिपोर्ट कराते हैं, 2 साल में बायोप्सी रिपीट करते हैं और 5 साल की ट्रीटमेंट पूरी होती है। ऐसे डॉक्यूमेंट मेरे पास जंगल पड़ा है साहब।
डॉक्टर साहब शायद अग्निहोत्री जी है हमारे पास, शायद अग्निहोत्री जी की कांटेक्ट से एमडी स्टूडेंट्स को ले आए जी आपके पास थोड़ा डॉक्यूमेंट करने के लिए।
हाँ, ऐसे तो बहुत सारे आ गए, सब मैं आता हूँ, मैं करूंगा, मेरे स्टूडेंट को भेजता हूँ, वो सब बोलते हैं। और अभी ऐसा सुनते सुनते 60 हो गया मेरे। सबको बोलना है, कोई मानने को तैयार नहीं होता। ताकि वो तो जो मेरे पास साथ में आके बैठे और वो फाइल का नंबर देखे तभी वो तसल्ली होगी। बाकी एक वैद्य और 38,000 पेशेंट देखेगा,
बिल्कुल नहीं जी,
वो कोई मानने को ही तैयार नहीं।
चलो,
लेकिन जो आता है वो देखता है, वो मानता है।
चलो,
और वो जंगल देख के भी कुछ लोग डर जाते, अरे बाप रे इतने सारे देखा।
डॉक्टर साहब शायद अग्निहोत्री जी से 1-2 शब्द ले। डॉक्टर साहब थोड़ा।
सर तपन सर का जो प्रेजेंटेशन है वो तो कमाल का ही है। जैसे आपने बात उठाई ना कि डॉक्यूमेंटेशन के बिना उतनी गति नहीं मिलती है। देखिए डॉक्टर वालेंद्र प्रकाश जी का, वैद्य वालेंद्र प्रकाश जी का डॉक्यूमेंटेशन के बेसिस पर ही उन्होंने ब्लड कैंसर में सारा रिकॉग्निशन ले ली है। तो इसलिए थोड़ा सा आप
हमको कोई रिकॉग्निशन नहीं चाहिए,
आपको नहीं, अरे
हमारे पेशेंट खुश है। आप देखो भाई, जो भी है बालेंद्र जी महान है, बहुत अच्छा काम करते हैं, किया है, हम कर रहे हैं और हमारे पास है। अगर किसी को प्रोजेक्ट डिजाइन करना हो तो प्रिलिमिनरी ऑब्जर्वेटरी डेटा हम आपको प्रोवाइड कर सकते हैं।
सर आपकी मेहनत का, आपके आशीर्वाद का सबको, जनता को, मानवता को जरूरत है।
तो मैं करता हूँ ना। अभी मेरे सामने मेरे ही लेक्चर सुनने वाले 53, 54, 55, 56, 57, 58 नंबर की मेरे पारायणी वैद्य है। वो मेरे से सीख के जाते हैं, काम करते हैं। 50 फुट मैंने किया, अब बहुत है। मेरे गुरु ने भी ऐसे किए।
नहीं सर आप में पूरी
मुझे पूरी दुनिया को ठीक करने का कोई
दिशा है, आप करा ले जाएंगे। अब एक्चुअली क्या है, आप अहमदाबाद में तो आपके नियर बाई ज्यादा हेल्पफुल होंगे, इधर तो दूर पड़ेगा। दूसरे जो एमडी लड़का करता है ना, उसको अपने 36 महीने में काम निपटाने की होती है, उसका ये क्रेज बहुत कम होता है।
वो कभी कुछ नहीं होता है, वो बजनते वाली बात होती है।
सर सारी प्रॉब्लम ये होती है, बच्चे को डिग्री चाहिए। आप सर कर ले जाएंगे, आपका काम बहुत ही बढ़िया है और बिल्कुल जीवनदायिनी है आपका, बहुत ही बढ़िया काम।
तो बड़े खुश, संतुष्ट और मजे कर रहे हैं, और दूसरों को भी जो हमारे पास आते हैं उनको खुश, मजे और संतुष्ट करते हैं। बाकी दुनिया पूरी को तो कभी कोई नहीं कर सकता। संहिताकार नहीं कर पाए तो अपन कौन होते हैं साहब। लेकिन मेरे सदगुरु 1978 से इस काम में लगे हुए हैं। कैंसर क्योर में 40% से ज्यादा रिजल्ट उसमें भी नहीं मिले। 38,000 है, लेकिन 380 फाइल्स ऐसी नहीं है हमारे पास कि जिसके पर हम थप्पू मारे का हाँ हमने उसको ठीक कर दिया। लेकिन 25,000 से ऊपर पेशेंट्स हैं उनको लगता है कि यार लेट पड़ गए, वरना ये ठीक कर दे, होता तो है नहीं।
डॉक्टर साहब, thank you so much for your wonderful presentation. शायद I don't know, Dr. Saab, whether you are staying with us, yeah, you are busy, and we will.
No, I have my routine yagna time.
हाँ जी।
I will have to keep.
फिर डॉक्टर साहब, फिर एक मिनट आपसे लूं। हमारे साथ है जी चंडीगढ़ से अवधेश जी, एक सवाल पूछ के फिर we change. अवधेश जी।
सर हमारे एक और सीनियर वेट कर रहे हैं सर, अवधेश जी को बाद में ले सकते हैं?
अच्छा ठीक है। नहीं,
नरेंद्र गुजराती जी भी तपन जी की तरह हमारे सीनियर हैं।
अरे वो तो मेरे गुरु हैं नरेंद्र जी, आप उनसे कुछ पूछ लीजिएगा।
अच्छा जी, चलो।
हाँ, मेरे से अच्छा वो बताएंगे।
जी जी,
चलो जी।
मैं गुरु
हम
है।
लोग जो भी एडिशनल है उनको अपन स्पीकर्स के बाद इनवाइट किया।
चलो जी, थैंक यू तपन जी। नमस्कार जी, नमस्कार नमस्कार। हरिओम हरिओम
हरिओम हरिओम सर, हरिओम सर। मैं अब अपने दूसरे बड़े भाई नरेंद्र गुजराती जी को आमंत्रित करता हूँ। नरेंद्र गुजराती जी भी जामनगर में मेरे सीनियर हैं और बड़े प्रख्यात चिकित्सक हैं, आविष्कारक हैं। ही इज इनोवेटर ऑल्सो, ही हैज इन्वेंटेड मेनी concepts. वेलकम वेलकम सर, वेलकम।
नमस्ते नमस्ते नमस्ते।
नमस्कार सर।
नमस्ते। दिखाई पड़ रहा है मेरे को भाई?
हाँ बिल्कुल बिल्कुल बिल्कुल।
आवाज
आप
सुनाई दे रही है?
नो स्मोकिंग डे के दिन धूम्रपान कराने वाले थे सर आज।
मैं तो धूम्रपान करवाता हूँ, है ना, लेकिन किस ढंग का धूम्रपान करना है, धूम्रपान क्यों करना है, और कैंसर में धूम्रपान जो है, जो भी मार्केट के अंदर जितने भी सिगार्स है, जो टोबैको कंटेंट वाले जो धूम्रपान करते हैं, जिसके कारण जो है कि कैंसर होता है। हम यदि कैंसर के पांचभौतिक को यदि जानते हैं कि कैसे होता है, तो पांचभौतिक में अधिकतर जो है पृथ्वी महाभूत यह अधिक प्रमाण में मिलता है, और जिसके कारण कैंसर बहुत प्रमाण में बढ़ा हुआ है। यदि हम इसको यदि सोचते हैं कि जितने भी टॉक्सिक जितने भी ड्रग्स है उसको समझ के यदि वो कैंसर होता है, लेकिन आपको अब मैं थोड़ी सी आज अलग बात करने वाला हूं। ये बात ये है, शर्मा जी सुनाई दे रहा है जी? तो आयुर्वेद में धूम्रपान, जैसे अभी आपने जो है तपन वैद्य जी को सुना, उन्होंने कहा कि भाई हमारे पास में 35,000 से ऊपर, मैं खुद देख के आया हूँ डाटा उनका सर, है ना, उन्होंने बहुत अच्छा काम किया हुआ है और अभी भी कर रहे हैं। हम दोनों भी क्लासमेट हैं। लेकिन आज मैं थोड़ी सी आपको अलग वाली बात कहने वाला हूं कि धूम्रपान से कौन से बीमारियां अच्छी हो सकती है और कैंसर को नहीं पहुंचाएंगे वहां तक के। उसमें कौन से ड्रग्स उसके अंदर आते हैं, वो ड्रग के बारे में आपको मैं बता रहा हूं। सबसे पहले जो एक्रोस कैलामस, मतलब जिसको वेखंड बोलते हैं, वचा कहते हैं संस्कृत में, वो वचा है। और दूसरा है बीबीतकी। आपको बड़ा आश्चर्य होगा ये सुन करके, मैं आपका समय बहुत कम इसलिए ले रहा हूं क्योंकि मुझे अभी दिल्ली के लिए ट्रेन है, जो आरएवी के अंदर अभी फंक्शन है परसों के लिए, इसलिए मैं अभी ट्रेन में जाना है। लेकिन शर्मा जी, पवन शर्मा जी का अभी मुझे जो मैसेज आया कि भाई आप 10 मिनट के लिए भागो, लेकिन आप जरा हमें सबको साझा करें। तो पूरे कोरोना काल के अंदर हमें किसी को भी जो है कोरोना नहीं हुआ। बिना मास्क के हम घूमे, बिना मास्क के घूमे, और आपको ये बताऊं कि सैनिटाइजेशन भी यूज नहीं किया, फिर भी हमें किसी को भी जो है कोरोना नहीं हुआ। जैसे कि आप समझ पाओगे कि कैंसर के अंदर जो है कफ प्रधान जो है, कफ महाभूत प्रधान है, वैसे ही कोरोना के अंदर भी जो है कफ प्रधान व्याधियां है, ये भी कोरोना। वो आयुर्वेद की दृष्टि से कफोल्बण वात पित्तज व्याधि है, ज्वर है, यह सान्निपातिक ज्वर है। इसलिए हमें समझना होगा कि धूम्रपान से कैसे हम बचेंगे। प्रिवेंशन के अंदर धूम्रपान कितना अच्छा कार्य करता है। तो आपको हर बार हम हर एक लोगों को बताया है, 2 साल से हम बता रहे हैं कि केवल दिन में 3 बार हम जो बता रहे हैं उसकी वर्ती बनाइए, जिसके अंदर वचा है, गुगुलू है और बीबीतकी है और परिभद्र है। ये 4 ड्रग्स है। जामनगर के अंदर इन सारे धूपन के ऊपर बहुत अच्छा काम हुआ है और धूम्रपान से भी काम अच्छा होता है। ये ड्रग्स के अंदर सारे एंटी माइक्रोबियल एक्टिविटीज है। डॉक्टर मेटकर हमारे सीनियर थे जिन्होंने जो है इसके ऊपर काम किया है और एंटी माइक्रोबियल एक्टिविटीज का प्रूवन बताया है। इसलिए और मैं कहता हूं पूरे भारतवर्ष में करीब करीब 5 से 4 लाख लोग, 6 लाख लोग इन्होंने धूमपान किया है प्रिवेंटिव के तौर पर के पूरे 2.5 साल में कोई भी कोरोना से जो है पीड़ित नहीं हुआ है। तो कितनी बार करने के लिए कहा है? तो दिन में 4 से 5 बार 3-3 पफ। अभी तपन जी ने बताया कि मुंह से लेना है और मुंह से छोड़ना है धूमपान, लेकिन शास्त्र के अंदर जो श्रेष्ठ जो है धूमपान है वो नासा से पीना है और मुख से छोड़ना है। इस ढंग से यदि आप दिन में 3 या 4 बार यदि करते हो तो अगले आने वाले वायरल डिसऑर्डर्स के लिए भी ये प्रिवेंशन का बड़ा कार्य बन सकता है। इसलिए क्योंकि उसका हमारे पास में डॉक्यूमेंटेशन है कि पूरे 4 लाख लोग आप देखोगे तो करीब करीब 4 लाख लोगों ने इसको यूज किया है पूरे भारतवर्ष के। अनेक जो वैद्य है इन्होंने ये धूपन भी चलाया है और नाक में केवल तेल लगाने का काम कराया है। नस्य नहीं, केवल नाक में तेल लगाओ। देखिए पूरे नाक में तेल लगाने से किसी भी ऑयल सरफेस के ऊपर कभी भी जो है कोई भी बैक्टीरिया या तो कोई भी वायरसेस ये कभी टिक नहीं पाता। इसलिए मैं कह रहा हूं कि हम तो उसके जीते जागते उदाहरण, हमने कभी भी जो है मास्क नहीं पहना। हमारा पूरा स्टाफ हॉस्पिटल का वो कभी भी नहीं पहने। सारे 6000 से ऊपर पेशेंट देखे, 1162 1162 केसेस का रिकॉर्ड है हमारे पास में। और धूम्रपान से और साथ में नस्य से, अभ्यंग से, ये सारी चिकित्सा और अभ्यंतर चिकित्सा से कोई भी एक भी व्यक्ति हमारे पास में मरा नहीं है। इससे ज्यादा और क्या चाहिए आपको? तो कहने का तात्पर्य शास्त्र के अंदर धूम्रपान के लिए जो जो व्याधियां बताई गई है उन सब व्याधियों में आपको सशर्त आपको काम करना पड़ेगा। इसलिए सबसे बड़ी महत्व की बात है धूमपान करना। यह इसमें ड्रग्स बहुत सारे हैं, जैसे श्वासकन धूम है, वो श्वासकन धूमपान भी कर सकते हैं जिसके अंदर दत्तुर, यदि जिसको श्वास लगता है, कई बार हो सकता है कि लंग्स कैंसर आपको मिले, लेकिन इसमें जो संप्राप्ति का विघटन करने का है वो संप्राप्ति विघटन के अंदर यदि आप धूमपान करवाते हो, वचा है, गुगलू है, घृत है, सिक्त है और दत्तुर पत्र है, तुलसी पत्र है, सुरसा, इन सारे पत्रों के आप धूमवर्ती बना करके नासा से लेकर के यदि आप करते हो तो आपका O2 लेवल भी उससे बढ़ता है, हमने देखा है। इसलिए ये सब चीजें करना चाहिए। और मैं क्षमा चाहता हूं आपसे क्योंकि अभी मुझे ट्रेन होने के कारण मैं अभी यहाँ से निकल रहा हूं, लेकिन इसके साथ में आपको ये पक्का जरूर कहूंगा कि टोबैको वाला जो धूमपान है वो हर किसी भी हालत में हमें नहीं करना चाहिए, जिससे जो है सबको तो प्रूवन है कि टोबैको वाला जो धूमपान है जिससे जो है कैंसर की बहुत अधिक मात्रा में उसका प्रचार होता है, प्रसार होता है। और इसके लिए हम सभी लोगों ने जो है कि टोबैको के विरुद्ध में काम करना चाहिए और कैंसर से हम लोगों ने बचना चाहिए। लेकिन कैंसर की अवस्था में, पहली अवस्था में यदि आता है जिसमें कफ बढ़ा हुआ है, ऐसी अवस्था में आप वचा, गुगलू, सिक्त, घृत और साथ साथ में जो है यदि श्वास बढ़ता है तो दत्तुर पत्र का प्रयोग करके इसकी धूमवर्ती बनाई है। उसके अंदर आप रजनी भी डाल सकते हो, सूरसा भी डाल सकते हो, कंटकारी भी डाल सकते हो। ये सारे ड्रग्स जो है यह प्रूवन है कि विच इज हैविंग द एंटी माइक्रोबियल एक्टिविटीज एज वेल एज जो कफ जो है विलयन करने वाला, यह सबसे बढ़िया ड्रग है। इसलिए हम लोग जो है धूम्रपान करवाते हैं। आपको यही ड्रग से धूपन करने से पूरे 2-3 साल में हमने जो है कि कोथ के पेशेंट, ये सारे कोथ के पेशेंट को जो है सेव किया है, जिनका एम्पुटेशन करने वाले थे, ऐसे सारे केसेस जो है उससे सेव हुआ है। इसलिए इन सब चीजों का जो है आप लोगों ने अपने चिकित्सा के अंदर प्रयोग करना जरूरी है। इसी के ऊपर यह धूमपान करना और धूपन करना, इसी के लिए दोनों के लिए जो है एक धूपन यंत्र, धूमपान यंत्र बनाया गया जिसको पेटेंट 4 साल पहले गवर्नमेंट ऑफ इंडिया ने उसको दिया है। इसलिए इस यंत्र का भी आप प्रयोग कर सकते हैं। कि उसका महत्व का क्या कारण है कि यह पेटेंट क्यों मिला? यू कैन डायरेक्टली प्लॉट द फ्यूम्स ओवर द अफेक्टेड पार्ट ऑफ द बॉडी, जिससे व्रण और शूल ये दोनों भी फटाक से कम हो जाते हैं। इसलिए धूमपान भी करना चाहिए और धूपन भी आप कर सकते हैं। यह सबसे बढ़िया अच्छा वाला जो है यह धूपन और धूमपान। यह वो शास्त्र में बहुत सारे धूपन द्रव्य दिए है, धूमपान की बहुत सारे ड्रग्स दिए हुए हैं, उसी सभी का हम लोगों ने प्रयोग करना जरूरी है। आप लोगों ने बड़े शांति से मुझे 10 मिनट के लिए सुन लिया, मैं आपका तहे दिल से आभारी हूँ। धन्यवाद। शर्मा जी धन्यवाद।
बहुत बहुत धन्यवाद, बहुत बहुत धन्यवाद सर। आपकी ओजस्वी वाणी में यही उद्बोधन सुनना हम लोगों के लिए आशीर्वचन था। बहुत दिनों बाद हमारी,
क्योंकि अभी मुझे ट्रेन है, मैं निकल रहा हूँ, इसलिए मैं क्षमा चाहता हूँ। ठीक है ना?
नहीं, कोई बात नहीं, कोई बात नहीं साहब। आपके पैशन को सलूट है कि आपने हमारा निमंत्रण स्वीकार किया। और ऐसे ही हमारे यहाँ एक कहावत है, होनहार बिरवान के होत चीकने पात। तो उस समय पीयूष जी ने भी, आपके सुपुत्र पीयूष ने भी बहुत अच्छा, बहुत ही अच्छा एक्सप्लेन किया था डेफिनेंस डे के दिन।
बराबर बराबर।
थैंक यू वेरी मच।
बहुत बहुत धन्यवाद सर, बहुत बहुत धन्यवाद।
नाउ आई वुड लाइक टू रिक्वेस्ट डॉक्टर स्वागत एंड डॉक्टर स्वागत, प्लीज वेलकम।
नमस्ते सर।
नमस्कार नमस्कार।
मीटिंग कैसे करने का इसको, चलो भाई।
So today the topic was very much interesting by Tapan sir, as he is one of my guru who taught me this treatment of cancer. He made me think in a different way, and he is one of the guru who taught me Nadi. So I respectfully take blessings from him before I start my speech. So today our topic was supportive care in lung cancer. The word supportive care, it is very much interesting. Why the word supportive care was taken? So in the international level, there is an association called Multinational Association for Supportive Care in Cancer. So what they did is they made in resolutions, and they included that management of physical, psychological symptoms which co-affect the give the side effects across the continuum of cancer patients. So we have to have a particular supportive care. Earlier it was said as palliative care. So what is palliative care? So palliative care is an approach to patients or family or caregiver, whoever does it, and for the optimal management of pain and other distressing symptoms at the end of this end stage of the disease. So people, what they think is supportive care or palliative care is now only for the end patient to improve their quality of life. But it is not so. Now it is totally changed. The supportive care has become completely different. So we have to understand what is supportive care. So supportive care means one which improves the quality of life. And supportive care includes all this social, spiritual, psychological, and physical health. The maintenance of all these is giving the supportive care. So there is a difference. And there was now palliative care has become main focus only in disease where the main treatment is not effective. So in those cases, palliative treatment was given, but now it is not of any use. So the change is the supportive care. So what we have to think as per Ayurveda, and how the symptoms has to be managed as a supportive care. So mostly what we see, patient will come as a diagnosed patient to Ayurvedic physicians, and most of the cases. And in that case, what they do is mainly after the chemotherapy and radiotherapy, they appear in front of us, or the patient will reject the physiotherapy, or he would have been rejected by the doctors for he is not fit enough, you get fit enough and come over here. So what we see is most of the conditions routinely what we see is pain, xerostomia, oral mucositis, nausea and vomiting, diarrhea, dermatitis, and urinary symptoms, and weight loss, male sexual problems, psychological problems, and mood dysfunction. These are some of the symptoms which we usually see. So what exactly we have to do in Ayurveda or as per Ayurveda? So before understanding of all this, we have to understand only one part. I don't go much of the theory wise, but one word I would like to add here is what exactly is the concept of the cancer we can understand. Some is usually in Ayurveda, some say it's Sarbuda, some say it's Gulma, some also include the Granthi Vidradi also is being included. Granthi is also been taken. Lots have been discussed about what is there. Multiple diversity in the references. Why? Because Ayurveda is symptom or presentation based science. So once it is a presentation based science, we diagnose the patient as per the presentation. Because for that purpose, here we have to understand two principles. One is Swabhava Paramavada. What is Swabhava Paramavada or Swabhava Paramavada? Swabhava means by nature, Uparama means destruction. There is a self-destruction of every cell. So once a cell, for example, we know that RBC cell lifespan is 120 days and it gets destructed after that. Likewise, each and every cell has got by nature to get destruction by themselves. Whereas in cancer cells, this doesn't happen. Even to go to one more extent, there is one more vada that is called Kshanabangura vada. We have to understand that. What does Kshanabangura vada says? Kshanabangura vada says that with every second there is a destruction and a new response. That means to say that what I am now, the next second I am not, because the cells have changed. Some cells are dead in my body and some cells have taken birth in my body. So this is a continuous process. Still to understand, there is a change. Some people consider there is a change in the Swabhava Paramavada. So this destruction or natural destruction process is changed. So this concept one has to understand before planning of the treatment principle or before planning of the Ayurvedic treatment or mainstream palliative care or the comprehensive care, whatever we consider. This is what the main thing we have to. Now the treatment, what is supportive care, this has become a multidisciplinary approach. So it is why this is considered as multidisciplinary approach here, because earlier it was how the people used to go to different allopathy doctors or super specialists and they get treated. Now this is not like that. Some people consider that for the pain management, acupuncture is good. For the acupuncture, there is a very good response. But what we say is, rather than acupuncture, there are certain physicians. Earlier on the other day, our Maharashtra Parampara Vaidyas, they were telling Vidya Chikitsa. Vidya Chikitsa and Agnikarma Chikitsa got very good result, especially in pain management, as well as in case of the management of the external cancer cells. So whereas your lungs is not external, we are not going into it. But for external cancer cells, in Jalgaon, one sir is there, I don't remember his name. He does wonderful treatment for external cancer cells and he is getting very good results. Just at a cost of 60 rupees per day, they get treated. Then, next, what about other care? What we see in treatment, first of all, dryness of mouth. The very most important in case of lung cancer, what we see is xerostomia or the dryness of mouth. So for that, what we can plan is the best treatment, what we can say is Kavala and Gandusha, or that is Kavala and Gandusha with not with oil also. Sir was telling us, I don't remember the second speaker sir's name. Oil is one such media wherein we can, no bacteria or parasites they get. So for that, Kavala and Gandusha, what we practice, it helps in maintenance of the hydration. It helps in curing any parasitic infection, and it regenerates the mucosa, and it also avoids the atrophy and ulceration of the mucosa. This is very much having a good result when compared with the treatment of the care which is given through this Ayurvedic for xerostomia. Next, what we can see is main is pain. For the purpose of pain, the best treatment what we can take is the Matra Basti. I think our Tapan sir did not tell that part. I was thinking that he would say, and what would I say? He left it for me. The thing what was sir's practice, Tapan sir also practiced, and he taught me that is any person who goes to the chemotherapy or radiotherapy, a Matra Basti is given. And after chemotherapy also, Matra Basti, Depending upon the condition, Grutas are there. Otherwise, Indukanta Gruta is taken. Indukanta Gruta is best and safest one, or the Dhanvantari Gruta is the ideal one. Unless and until it is an anorectal cancer or any GI tract cancer is not there, then Matra Basti is best for pain management, also for the supportive conservative management and of the protection of the patient for that side effects of the chemotherapy and radiotherapy. Next, what we can see is after that treatment, next one, Matra Basti, one can go with the, depending upon the condition, we can plan the Mamsarasa Bastis. There are certain Bastis which is explained in Ayurveda as Mamsarasa Bastis. These Mamsarasa Bastis are considered upon because this disease is Mamsagata Vyadi. If you understand, this is a Mamsagata Vyadi. So, Mamsam Mamsa Vriddhi. There is Mamsa Kshaya also because of the chemotherapy. Again, you can go with the Mamsa Basti. Or else we can also give with the Shira Bastis. And to a certain extent, Abhyanga can be done in certain conditions of the patient. Abhyanga also helps. Next, coming to the next part is the Dhumapana. As I was telling, one of the Dhumapana. Other Dhumapana, what we practice here is Haridra Dhumapana. It is very safe method of practicing Haridra Dhumapana because many theses has been done at our SDM Udupi, and even we practice it at our OPD levels also. That Haridra Dhumapana is considered to be the safest version for the purpose of the lungs or any pranava soto vikara. It is considered to be the best and safest one as per the Dhumapana. Because Haridra has got the potency only at the level of the Lekana Karma to any Vriddha dosha, and it doesn't derange any other than that. So next is the, for psychosomatic disorders, we have got wonderful therapy, that is Shirodhara. Shirodhara, you can go with the Ashwagandha Kashaya Dhara, you can go with the Thaila Dhara, you can go with the Jatamamsi Kashaya Dhara, wherein the person gets relaxed space and he gets very good sleep. And next is the other treatment part. What we can plan out here is the best version is this. What we use in South is Ballataka Asava. So you can see what is Ballataka Asava. You can ask, no one prepares that, you have to prepare by yourself. Only 3 ingredients. One is Ballataka, the other is Chitraka, other is Amruta Guruji. Only these 3 things we prepare Ballataka Asava. We prepare for ourselves. So this Ballataka Asava is given for almost all the cancer patients, and we get as a shield, protection shield for them, so that we can prolong them. And other treatment what we give is the Varunadi Kashaya. And next is the, depending upon the nadi of the person, there are certain basic treatment principles which we give, like Mahamatu Vidyam Tarasa has been given, or plain Triphala is given, or if the person is having some related with the liver, then we go with the Madhifala, or the Madhifala Rasayana has been given, or the Madhifala itself is brought. If it's available with the patient, we ask them to bring and we treat them accordingly. So depending on all this, and next one, in my principle, what I got is, we get a powder, or someone has was asking about the arachnid. So we get LSM Churna. If Laghu Sutta Mishna Churna we get. I personally prepare Laghu Sutta Mishna Churna with the Samira Pannagarasa. I mix that and give the ratio. I'll tell you, the ratio is 100 gram of LSM Churna with 10 grams of Samira Pannagarasa. This works wonders in almost all the cases, especially with smoker stuff and smokers phlegm. It cleans within 5 days. I bet anybody, the people come to the patient, they ask me that, please give me the smoker's capsule, that capsule for removing the kapha. There is so this is a wonderful combination, and we make capsules by ourselves, and that comes about 1 gram. The dose what I give is 1 gram capsule we make here. So that is in 1 gram, that is the 900 gram of the powder and 100 grams of the 100 milligrams of the Samira Pannagarasa has been added, and this gives wonderful result. And Kanchana Gugulu and Hirakavasma, and people has to try, rather than many people combinations are there, they are only with the Hirakavasma they are trying. One has to try the Emerald Basma. That Basma, it gives wonderful result in case of specific diseases for the protection. And there are many treatment protocols which I don't want to discuss. But coming on to the age-old practice of Ayurveda, we have gotten very good supportive care in which we can consider this, and we have to channelize this. As our very dignitaries are present here, we have to channelize this so that multidisciplinaries have to approach this for the supportive care. So I personally consider the list of them are like Abhyanga, Domapana, Shirodhara, Nasya, and Anuvasana Basti or Matra Basti, or even Kshira Basti, Mamsarasa Basti, Gandusha, Kavala. All this, we have to make a protocol that if a patient is not going in for the treatment of the chemotherapy and radiotherapy, what would be our mainstream treatment and supportive care treatment. If they are going for that treatment, what should be our protocol for this? So we have to sit and finalize these, and if we make that, other disciplines or world should turn to Ayurveda to consider this supportive care protocol, and they have to adopt the Ayurveda supportive care treatment. With this, I conclude because even I am in a hurry with today. Thank you, Ananda.
Thank you. Thank you. Swagat ji.
Excellent.
Oh, Pawan ji is here. Pawan ji.
जी सर, excellent जी. स्वागत जी, आपने बहुत ही संक्षिप्त में in very brief you have communicated each and everything. Excellent, Dr. Swagat. I welcome you. Now I would like to request Dr. Beena ji. Dr. Beena ji, she is also our guide and resource person from Mysore. Dr. Beena ji, welcome, madam.
Namaste, sir. Om Shri Dhanvantare Namaha.
Swagatam.
All designates Pawan Kumar Sharma ji, sir, and Madan Tangavelu, sir, and Agnihotri, sir. This is the second time I am presenting. So here I would like to start with the case presentation, so which has come to our hospital. I think I am audible, sir. Am I audible, sir?
Yes,
We can hear you.
Yes. So this was a diagnostic case of adenocarcinoma of stage 4. A 39 years old female approached our hospital with the complaints of cough and moderate to severe pain in her left side of the chest and back, having difficulty, breathing, that is with the Shwasa Krichruta. So this was very often since 1 year and 6 months. And there was a complaint of weight loss to about 12 kgs within 1 year, 6 months. And also having generalized weakness and a complaints of fever off and on with, the difficulty in intake of food to little bit like, so she will not be having a proper appetite, all those things, and sleep disturbances because of the pain in the chest. So this was the complaint of the patient. So this was the case diagnosed as a adenocarcinoma of the lung 1.5 years back. And this patient was on modern medication, that is only the symptomatic medication for the cough, breathlessness. She used to take some medication, that's all, but she was not gone for the chemotherapy or the radiation therapy, even because she was not interested to take the modern, chemo or radiation line treatment, because she was very much afraid of the side effects of those things. So what she was decided was, whatever it may be, I will die with this, but not because of the chemo or radio. And she has approached to me with these complaints, and we started with a, even the complete examination has been done, the physically as well as even the radiological examinations, everything was done. So it was a very proven case of adenocarcinoma. So what happened was, whenever we treat a case, and similarly, one more case was also there, a male patient. So he was also about, this case was, the lady was only 39 years, wherein another case was, the patient was aged about 79 years old. He was a chronic smoker. So without smoking, even in the hospital also, he wanted to smoke. So that was the addiction of that patient, but wherein the lady was not a even second-hand smoker also, because there was nobody in her family was also having a smoking history. So this was the two cases wherein both the conditions I have seen the breathlessness, cough, and the weight loss, all those conditions. So whenever we wanted to treat a particular condition, we definitely should have a diagnosis, or it will be completely like based on the symptoms we will be treating. So when I searched, what I understood is the different terminologies, when even so previous speakers was also telling. So the cancer will be considered as arbuda, gulma, or whatever it may be. But we also should consider the other, the different diseases when they have, told about the what you can call the sannipataja, or even the conditions wherein it is said to be asadhya should be considered. So when I have gone through these symptoms, so what I have understood is in Charaka Samhita or even in Vagbhatacharya as well as Shushrutaracharya, while describing regarding the kasa, so they will mention the two important conditions like Shataja kasa as well as the Kshayaja kasa. So here in both these conditions, what is the Nidana mentioning for the Kshatraja kasa as well as the Kshayaja kasa is almost it is similar. So that is like the Nidanas mentioned here is like Ati Vyavaya, Ati Bharavahana, Ati Adva, that is excessive sexual indulgence, lifting heavy weight, walking, and intake of Vishama or faulty Asatmi Ahara, that is unwholesome food, and having hatredness, grief, and having a habit of Vega Nigraha, that is suppression of the natural urges, leading to Vata Pradhana, Tridosha Janya, that is Tridosha vitiation, leading to Kshata or injury, and Kshaya or tissue depletion or degeneration, initially in the urus, that is the chest, and later seen in the whole body if not treated properly. So this is the Nidana for Kshataja and Kshayaja kasa, wherein all the maybe we will think that what is the Pramita Ashana, that may be intake of very less intake of food or whatever it may be, or a Bara Advana, or if it is not there, simple, the hatredness what we have in ourselves, or what you can call that is something like a strenuous activities, all those things will be leading to the Vata aggravation. So which will be eventually leading to the Kshata in the urus, that is in the chest, leading to either Kshayaja kasa or Kshataja kasa. And even the mention in the Kshataja kasa, so the kasa where it starts with the Shushka kasa, later there will be Raktakshtivana. Or even in the Kshayaja kasa they tell, so initially there will be lot of the accumulation of the doshas in the urus and leading to the pyogenic, like of a kind of, that is the pus formed like a feeling, or even the cough also they will be getting the sputum like a the pus feeling of the smell, etc. So this was the condition where I have correlated, and I have seen that even the same we can see in this patients, wherein here the prakriti of the person was also Vata prakriti. So that is also very, very important with Vata predominant, and it gives the history of some of the etiological factors, like even the patient was also having less intake of food with irregular timings, and most of the days taking bakery items and often lifting heavy weight and irritative nature, and also she was having very stressful life. So because he was a lady, usually the ladies will be getting comparatively, the cancer will be lung cancer will be less compared to the male, but still here this 39-year-old lady has got all these things. So when we dig into the nidanas, so this was the different kinds of nidana I found in her, wherein all these things lead to the rukshata, that is dryness of the body, and there was agnimadhya, altered appetite, and leading to the increase of vata dosha, wherein there is also vitiation of pitta and kapha, resulting in kshata or kshaya in the urus initially, and later it will be the other lakshanas like the loss of appetite or dhatu kshaya, that is loss of weight, or shushka kasa, that is dry cough, parshva shula, pain in the chest and flanks, and then shwasa, that is breathlessness, jwara, repeated fever, daurbalya, or the generalized weakness. So these are all the conditions, even it is mentioned in both the Kshayaja and Kshataja kasa. So based on that, the treatment protocol was framed. So what happened here is, that is by seeing the signs and symptoms, it is what I started is initially started with the Mradu Shodhana, that is a mild purgative treatment. Why? Because that I will come to the end. Why? What is the reason behind it, or how we can discuss regarding the treatment protocol. So what I framed here is a Mradu Shodhana, that is a mild purgative therapy with Gandharvastha Dierenda Thaila 30 ml with 10 ml of Gomutra Arka after assessing the koshta of the patient. Okay, so this was followed by the Rasayana therapy. So this was like the Rasayana therapy here, what I have taken is the Shivagutika. And later the other things like whatever the symptomatic management the patient was wanted, like the Shwasa Kutara Rasa, because she was having Shwasa Krichruta, and the what you can call the other things like the Dashamula, Katutraya Kashaya, and the other powder combination like Yashti Madhu Churna, Pippali Churna, Talisadi Churna, and Shataputi Abraka Basma was added when and where it is required. So this treatment was given for about 3 to 4 months, and the patient, whatever the symptoms was there, by the end of the 3rd month, she was having a very good result. And even we have repeated the radiological examinations. There was no further growth of the tumor or something like that. And even this lady was like even up to 1 year, 8 months she was there, and very recently she died because of the heart attack. Actually, it is not directly because of the lung cancer. And what I wanted to tell you here is, so here the treatment principle of Kshataja Kasa I would like to, Kshataja and Kshayaja Kasa I would like to discuss here. That is according to the Charaka Samhita. Here according to him, it is the Madhura and Jivaniya Aushadha Prayoga, that is administration of having sweet taste and which are nourishing in quality. So that is what we have seen in that patient. Because of the carcinoma, both the patients, they have lost their weight, almost some 10 to 12 kgs in one case, and another one is some to 8 to 9 kgs. So that was the thing. So even the treatment principles of Kshataja Kasa, he's mentioning Madhura and Jivaniya Aushadha, that is administration of drugs having sweet taste which are nourishing in quality, and Bala Mamsa Vivardhana, Ahara and Aushadha drugs. When Tapar Kumar Vaidya sir was telling, like even we have to consider the 3 important aspects, that is the Rasa Pradoshaja Vikara or Rakta Pradoshaja and Mamsa Pradoshaja. So he was telling like one is Rasa Pradoshaja is like Langhana, and the other one is the Rakta Pradoshaja, that is Rakta Pitta Hari Chikisa or the Virechana and Upavasa, and Mamsa Pradoshaja according to the condition we have to do whatever the particular the provoking factors are there, we have to counteract it, like maybe a Visha or something like that. So here also the same treatment line was followed. Even when you see Charaka Samhita, the Kshayaja and Kshataja Kasa, the same line of treatment has been mentioned. That is, first one is the for both the conditions he is telling, that is the Virechana has been mentioned here in both the Kshayaja Kasa and Kshataja Kasa. He is telling Virechana line of treatment, that is a Mrida Virechana he is mentioning here. And while telling, he is telling that is the you have to follow the Kshataja Kasa, you have to follow the Pittaja Kasa Chikisa. So wherein again in Pittaja Kasa they mentioned the Virechana as the line of treatment. So here once again he is telling administration of the drugs having sweet taste and which is also nourishing in quality, or Bala Mamsa Vivardhana Ahara. So once again, after having this Langana, that whenever we tell Langana, there are 10 types of Langana, including the Chatush Prakara Samshuddhi or the Virechana line of treatment also will include here. Okay. So what happened here is, so also to follow the line of treatment of Pittaja Kasa, that is what I was telling about the Mradu Shodhana and the Brahmana Chikisa. So in both the conditions, the Brahmana Chikisa, the Mradu Shodhana as well as Brahmana Chikisa, that means whenever this particular condition, there is a Dhatukshaya, means of course there will be obstruction or there will be Vata Vriddhi will be there. So in order, and there will be Agni Mandya. So here we have to consider 2 to 3 aspects. One is Agni Deepana and second one is Shroto Rodha. So what our Mradu Virechana with Gandharvastha Dierenda Thaila will do means, it is actually a special kind of this, especially the what you can call the this particular Gandharvastha Dierenda Thaila is, it is Madhura in nature, it is Katu and it is Vata Kapahara and it is Pittahara, it is Sukshma, Tikshna, Sara, Snigdha and it is Shroto Vishodaka. So this is the guna of Gandharvastadi Eranda Taila. We will not consider it is only as a Vatanulomana, but it is also having Vata Kapahara and it is Pittahara. It is also Pittala. And Sukshma, Tikshna, Sara and Snigdha, Shroto Vishodhana, and it is also Vrishya and Vayastapi. So this is very, very important, and it is also Balakara. So it is not only having a simple, a property like a Vatanulomana or just to have a Mridu Virechana, but also having the other properties. And even the Gomutra. So Gomutra, of course, nowadays more and more research work is going on Gomutra. That is also acting as a Tikshna, Sukshma, Vyavaya, Vikasha, as well as it is also acting as a Shroto Shodhaka. So the whole idea here is giving a Mridu Virechana and later giving a Rasayana or a Brahmana Chikitsa is really helpful in this particular condition. So what I did is after the Mridu Virechana, so this Rasayana therapy was given. So, and after that, what I have observed is every 1 month, 1.5 months, I used to repeat this Mridu Shodhana for 2 to 3 days. Again, I used to tell them to consume the same medications. So with that, they have got very good result. Almost her signs and symptoms has been come down up to 80 to 90%. She was leading her normal life. And moreover, the weight was maintained. So she came at the time of the consultation in the OPD, her weight was 43. Till the last consultation after 1.5 years also, she could able to maintain like 43.5, 44, again 43 like that. So that was the maintenance of the, particular, the weight of the patient. That means here what we could able to arrest the depletion of the dhatus further. And even the further there was in the classics also, the Gomutra Prayoga has been mentioned in many advanced cases like Jalodhara, Pandu, Arshas, especially as a Shroto Shodhaka, because it is having the Kshara or the Ksharana Guna, because we know that it is having the alkaline or the scraping nature, and it is having the Ushna Virya and Agni Dipana. So this is what the combination has given, that is Mridu Shodhana with Gandharvastya Eranda Taila and Gomutra, followed by the Shivagutika. So here one more important thing is, by administration of the Gandharvastya Eranda Taila along with Gomutra, it has helped in the Vatanulomana, which is very, very essential in any cancerous condition, because Vata is very much deranged or abnormally deranged in this particular condition, wherein we know there is an excessive proliferation of cells. So as Tapan Kumar sir was telling, there was a Sprati Nasha in the Kala, because the cells doesn't know when to die or it will not have its death. That is, the apoptosis has been lost in this particular condition. So here that is mainly because of the Vata Vriddhi that we have to understand. So control of Vata is very much essentially that has been attained with the administration of Gandharvastya Eranda Taila and Gomutra, and which leads in turn to the what you can call. So this will have the Vata control effect. And the Shodhana therapy, it is very important when and where we have seen in the classics also. Before telling the Rasayana therapy, there is a mentioning of Shodhana. So this is again very much important. We know that the Rasayana uptake will be there by the cells when they are in the normal state. Only a normal cell can take the Rasayana effect of the drugs properly, because whenever an abnormal cell, that is maybe the reason whenever we administer the Rasayana therapy, maybe we are strengthening the normal cells, but the same Rasayana cannot be uptaken by the cancer cells, because that is having a different structure than the normal cells. So we have to strengthen the normal cells, and these normal cells, after strengthening, that will fight against the cancer cells. So this is the concept what I have understood, and accordingly I have formulated this particular treatment principle by not violating the treatment principles from Charaka Samhita of the Kshayaja and Kshatajaka. So even the Shivagutika, what I have selected is because Shivagutika has been proven for its anti-cancerous or anti-tumor activity, and there are so many journals published on that. And it is also having more than 50 herbal drugs like Tripala, Dashamula, Guduchi, Patola, Yashti Madhu, Gomutra, having Shilajit as its main content, and which is also having multiple indications like Shwasa, Kasa, Gulma, Vidruddhi and Arbuda, and so many, the multiple benefits are having after with the intake of Shivagutika. So this is what the study I have taken in 2 lung cancer patients, one in male and one in female, one in very young age and one in the old age, wherein the smoking was the very prevalent history, like the very strong history of smoking. Okay, so this was the thing. So to tell or to conclude, so what we have to understand is whenever we treat a case, try to have a diagnosis, maybe a near diagnosis, and try to adopt those treatment principles. And when we use it in our practice, definitely it will be very beneficial to the patients and we can see a very good result. So this is what I wanted to conclude here, and thank you very much for the opportunity.
Very great, madam. Nicely explained. Very nicely explained.
Thank you, sir. Thank you.
Very excellent. Madan sir, welcome, sir. Madan sir.
Pavanji, thank you. It is for me, Pavanji, this today has been again one of those PhD level classes. I'm learning so much, including Beenaji's Shivagutika. I'm just looking, as she mentioned Shivagutika, I'm just reading up about Shivagutika. I have Beenaji, thank you. Swagatji, thank you. And to our 2 very senior Vaidyas, very, very senior Vaidyas. Thank you. What I feel from here is the level of expertise in the country being bold enough to engage with cancer. Tapanji gave us a very interesting overview on the IRES, looking at it from the perspective of some fine details of the Deha Paramanu and how the Kala Smriti is lost, the intelligence. And that is so wonderful. It's a very nice description. And then he went on to touch on many things. Thanks to Harishji for asking 2 questions. I wish very much to open this. I think Beenaji is still here with us. Swagat is still here with us. And I'm curious to see if I want to bring in Avdesh Pandeyji here because he is our person from the...
Welcome, Avdeshji. Welcome.
Avdeshji, namaskar. First, your Avdeshji, आपकी तरफ से आपकी सोच की आज की जो 4 presentations के ऊपर दूसरी चीज, how can we make this dialogue a little more smooth running कि modern medicine की तरफ से और Ayurveda वालों की. Looking forward to your thoughts, comments.
Sir, I practice radiology. I do the PET CT scans of these patients. And we do all kinds of radiological investigations to actually see what is the condition and how the condition is changing. My basic one request to all people who are practicing Ayurveda is, my request, please don't take it.
Please be frank,
don't take it otherwise.
We want you to...
We look up to Ayurveda for everything, sir. We should not bring Ayurveda to a level of comparison with modern medicine because it is incomparable. That is the first statement which I want to give. Ayurveda is much, it's the mother of all therapies known, and what will be known to mankind, Ayurveda is much above that. That is the first and foremost statement that I want to give. The second is our understanding how we are reversing. We are on the process of reversing cancers. Many of them we have done. Up till now, 11 cancers in the last 6 to 7 months' time, we have reversed. Reversing a cancer, I'll tell you, stage 4 cancers, making it stable is a miracle. If you make a U-turn, that is a miracle in a miracle. If you reverse it completely, that is no cancer at all. That is miracle in a miracle in a miracle in a miracle. So what people are seeing is, we are giving this kind of food and the cancer is reversing. That is what they are seeing. We are not only touching the patient at this level. This is the Annamaya Kosh that we are touching. We are also touching the Pranamaya Kosh, wherein we are making them do a lot of yoga and prana. I would want to elaborate here. People think that breathing is pran. Breathing is a very small part of pran. Pran is the life force, and pran ka vyayam throughout the body is pranayam. Breathing is kick starts the pran. The next is we touch the manomaya kosh. Somebody was talking that they are very irritable and they have got many prejudices. The manomaya kosh needs to be touched. We do that. Then we touch the vigyanamaya kosh. Vigyan, I would request people who know English never to compare Sanskrit with any other language for that matter. Vigyan is Vishesh Gyan. All the Gyan that you get, you get it through the five senses. And jab iska manan aap karte hain, that is Vigyan. And you get it through the sixth sense, that is the pineal gland. So what we do is, somebody mentioned Shirodhara. We do Shirodhara of all patients. We do it slightly differently because we are practicing integrated medicine. We integrate all kinds of therapies to actually help the patient. So while we are doing Shirodhara, we don't pour the oil, we give it drop wise, and we keep the eyes open so that the patient is looking at the drops that are falling. And this takes them in a trance. And the music that we play works as healing. We are starting a course of vibration as medicine, wherein in 2 months' time, we are starting this course for 2 months. So wherein we will show you how vibration is actually causing healing. And then last, we touch the Anandamaya Kosh, wherein the patient, and the healing comes from here. It percolates, it's a top-down approach like that. And healing comes from here. We start from here and the healing comes from there. And that is how we are able to reverse cancers to a great extent, stop it there to a very great extent, reverse to a great extent. And that is how we are doing it, sir. Just wanted to let you know how we are doing it, sir.
Thank you. Thank you. Before we let you go away, Avdeshji, can you just tell us a little more the innovation that you have done for Shirodhara, where you are doing the dropwise? Thoda aur batana ji iski.
What we do is, ye Shirodhara mein oil or anything that they put there, they pour it and they cover the eyes. We don't cover the eyes, we open the eyes and we pour it dropwise and ask the patient to count it. Now, while he's, because we want his total concentration to go there. In that process, we take the patient in a trance that is called the hypnotic state. And then we play the soothing music that actually, that vibration actually heals. And this is working very well. We are doing this project with IIT Kanpur. And this is the protocol that we are following. And we will evaluate the results very soon. So we are doing that. We are in the process and we are getting very good results also. Just wanted to let you know.
Avdeshi, thank you. The reason why I'm asking these small questions is Punjab is the capital, cancer capital of India, Bathinda district, etc. As we go further north to Punjab, there is a big unfortunate situation there. I think it is still as bad today. So you are in the heartland of this thing, and hence I'm trying to just provoke you a little bit to see how you are experiencing, how you feel about that situation there. So please stay with us, Avdeshi, please stay with us, because I want to get some comments from Beena ji and also Swagat ji about your small innovation. Swagat ji listed the different kinds of Shirodhara that you can have, oil or different formulation. I don't know if Swagat ji might be busy with patients. Maybe Beena ji can just give us a little more insight into some of these innovations. Beena ji, namaskaram. Harish ji, namaskaram. Beena ji,
yes, sir.
How easy will it be to have a more important dialogue with modern medicine people? Avdesh ji is one example. There are many other people.
Okay, sir. Sir, Actually, that is what I was explaining to you. I mean, in my presentation. So whenever we take any cases, as another speaker was telling, like usually we will be getting in the later stage with multiple signs and symptoms. Sometimes even, because very recently I got one case that was a CA ovary, and that was treated like with radiation therapy and surgery and all previous some 1.5 year back. And later, they have not gone for any the follow-up and all. And later what happened? The metastasis was to the liver. So that liver metastasis, they have understood just 6 months back. And by the time when they came to us, it was like, in a very, all the biochemical values, like the bilirubin total was around 25 or something like that, and totally it was like yellowish and almost started with ascites and all. So in such conditions, we may not able to do a kind of, only it will be a very little supportive therapy we can do, because that patient, after taking the medications from me, she was there about some 3.5 to 4 months almost. But the thing is, just before dying, just she came some day before yesterday to our OPD, and she was in the car itself. They just told me, you just come and see doctor. Like, by the time I was seeing, she was having very much breathless and totally yellowish discoloration of the body, everything. She was just telling, I'm not able to take the breath. So that was the condition, and I could able to sense that within few minutes, I think she is going to die. Then I told, just take to emergency care. By the way, she has lost. So that is what happened. But the thing was, even they were happy only for the thing that till the last breath, she could able to speak, and morning also she could able to take food, and she was doing her routine thing. So that was the benefit, the supportive therapy what we can give. Other than that, what I have seen, because I am doing my controlled the comparative clinical study with the modern, without any supportive therapy, how people are suffering, and with the Ayurvedic treatment, how people are getting the better quality of life, at least till their end of their life. So this is what I'm doing right now, actually. And seeing lot of benefits with the patients, and they are also like, nowadays people are coming in the last stage of the case, or even sometimes before that also they are coming to us with a lot of faith in Ayurveda.
Rinaji, don't go away, please, because I see Harish ji has raised his hand. I want, if I can get Harish ji in, and then I want to come back to Avdesh ji. Harish ji, namaskar ji.
सर नमस्कार, डॉक्टर अवधेश जी नमस्कार। पहले 2 सवाल आपके लिए। पहला तो, क्या आप अपना टोटल प्रोटोकॉल जो आप कैंसर के लिए अप्लाई करते हैं वो शेयर कर पाएंगे? नंबर 1। नंबर 1। नंबर 2, आपने कहा शिरोधारा में वाइब्रेशंस आप क्रिएट करते हैं, तो क्या आपको मैटर करता है कि आप ऑयल यूज करें या क्वार्ट्ज यूज करें या तक्कर यूज करें? किस तरह का मटेरियल आप यूज करते हैं, या एक ही मटेरियल से आप उस तरह की वाइब्रेशंस ले पाते हैं जो आपको चाहिए?
Thank you, sir. Thank you for asking the second question also. The first is, we want the society to be disease free. That is why we have started this institute called Hospital and an Institute of Integrated Medical Sciences, wherein we are starting courses also very shortly. We have sent to the university to get a permission for that. The second is, your second question was, the idea of doing Shirodhara, and the idea is to decalcify the pineal gland. Now, it does not really matter, since I'm doing a PhD on the pineal gland, that is separately. I mean, I'm doing a PhD on the pineal gland. So I have a big insight, and it is my thesis topic also, that as you decalcify the pineal gland, you are regressing cancer. So it does not really matter what you are using here, because in all probability it is not getting absorbed in the pineal gland. What we are doing is, we are opening up the pineal gland. And we are doing many things apart from the Shirodhara that I just mentioned. We are making the patient sit in sunlight for almost 2.5 to 3 hours. And in India, we are fortunate that we are in India. We have 2.5, 3 hours of sunlight. At your place, probably you don't have that. That is the first thing. The second is we are doing a lot of acupressure things to actually decalcify the pineal gland. We are using haldi to decalcify the pineal gland, and we are using music therapy to decalcify it. So we are doing a combination of many things to decalcify it. The idea of actually pouring the oil, we are using oil, drop by drop, is the patient is fully concentrated, when will the next drop come? And this is exactly what we want, because we want to take him in that trance, wherein the music that we are playing from outside is actually reversing the calcification of the pineal gland. That is the idea.
Avdesh, please stay with us. Please stay with us, because I want to bring our senior teacher. Please, Swagati, please.
There was a study which was conducted with only water. Water was taken for Shirodhara, and a different kashayas was taken, and also oil was taken. The overall changes was not statically significant. That means to say that whatever you pour, the procedure is most important, not rather the medicine. This was the research which was done, and it was concluded. So as for the procedure and the height and the amount of drops what you take, and these all things matter in Shirodhara. As this was not the main treatment part, I did not discuss all those. This is a supportive care, so I went on only with the supportive care. So Shirodhara procedure is most important. This is what I wanted to add.
Absolutely. And one more thing, sir. The somebody was mentioning Abhyangam. It is dangerous, because if there is multiple skeletal metastasis, Abhyangam can actually fracture the bone. So we need to be very, very careful when we are doing any procedure that is invasive. In a cancer patient, especially stage 4, when they come to us, almost all their organs are failing, their mind is failing. The relatives that have come with the patient are there, and they are just going to deposit the patient and go back, and then everything has failed for the patient. So we need to be very careful. Somebody was mentioning Abhyangam for these patients. We should not do it unless we are very sure that there is no skeletal metastasis. Otherwise, we'll end up in fracturing the bone.
Avdesh, thank you so much. I want to come back to the pineal gland thing, because we know the pineal gland is almost like a master clock. It controls so many aspects of the body clock. I want to bring that wonderful phrase that Tapanji used, and that also Binaji used, which is the Kala Smriti. Now, are you pointing in from, you have an understanding of both sides. Are you suggesting that the decalcification is going to bring back that intelligence of the body clock or something like that? Is that the physiology there that you're trying to reestablish?
It is like this, sir. Since I know Ayurveda also, I know that, this a body is Jivant Chetana. And the Chetana is capable of many, many things. It is the energy. Man is capable of many things. He thinks he is not, because he has not been tested that way. So when we are doing Kundalini, what are we doing? We are Urvardagami. We are making it turn northwards. So the energies that you get at the Agya Chakra, that is the pineal gland, if you are actually able to deliver that, that is what we are trying to do, because we are doing that all lam, vam, ram, yam. We are trying to do that for all these patients, plus Shirodhara, plus the onion therapy that we are doing. We are doing that with the SH group, and we are actually documenting it scientifically what we are up to. What are we trying to do as far as this is concerned? Like, for example, if I tell somebody that you eat while you are having a chest pain, instead of taking nitrocontin, why don't you eat adrak? Now somebody will say, adrak, oh, what nonsense. I will eat nitrocontin. So what is the principle? The principle is to increase the cardiac reserve flow. Now, nitrocontin increases the cardiac reserve flow to 2 ml per minute. Adrak increases it to 8 ml per minute. And we are the people who are doing the test. We are the people who are documenting it. By a PET CT, we have a protocol. We will know what drug can increase the cardiac reserve flow. Adrak is 4 times more than nitrocontin. Why should I use nitrocontin? That is the reason why I said in the first place, Ayurveda is much above. I mean, let's not bring it to the level of modern medicine that, I have got paracetamol. Do you have Sudarshan Vatti and things like that? So Ayurveda is much above that. That is what I would just want to say.
Avdeshji, please stay with us. I know you are a busy man, but stay with us a little bit because I want to get some feedback from our senior Vaidya here, Domaji from Telangana. Domaji, namaskar. And I'm also hoping Harishji's answer is, Harishji, I hope you can dialogue with Avdeshji to understand the protocols better. And Harishji has studied Ayurveda in Punjab, so he knows Punjab very, very well. And he will connect with you, Sir Avdeshji. Domaji, please.
Madanji, namaskar to all.
Namaskar ji.
And inviting me a question and answers. And I congratulate Avdeshji, though he is the representative of modern radiology, who is very Palishyati iti Vishwaso Siddher Pratama Lakshanam. Dvitiyam Shraddhaya Yukto, Trutiyam Guru Pujanam, Chaturtham Samata Bhavo, Panchamendriya Nigraha, Shashtancha Pramitaharo, Saptamam Naiva Vidyate. It is not the epoch of anybody but Lord Sadashiva to Parvati. That is why I congratulate many times Avadeshji, who is Palishyati iti Vishwasaha. Though the therapy representatives who are turning the pages to deliver their lecture, they are not Palishyati iti Vishwasaha. They are weak in Vishwasa. But whereas Avadeshji is not of the representative of Ayurveda, but though modern medicine, but Palishyati iti Vishwasaha Siddhihi with Avadeshji. This we should feel it belittled. Those who are trying to represent as we are the lords and gods of therapy. Perhaps my words will be bitter to somebody and very edible to somebody. I do not bother for anybody's reaction. My presentation will be straightforward. Whomsoever, Abhimanam Surapanam, Gauravam Rauravam Dhruvam, Pratishta Sukaravishta, Treyam Tejet Harim Bhajet. Avadeshji, this also you refer if at all anywhere is necessary. I feel proud of you. Being a very good presentation in this respect, I am not actually a postgraduate or a PhD scholar. I feel myself belittled because my academic career was not to the mark of the alphabets. Of course, nobody should develop any inferiority, superiority complex. As far as my Gurudeva's instructions are concerned, that is why I am putting forth. For the first presentation I am giving, that what the two speakers, they are masters of presentation. Actually, I put in my chart box also. And the second thing is this, whereas Lankhana is concerned, my chart box also containing these words, that in general, Ananda Margis are supposed to observe 16 points very strictly. If they do not follow 16 points and yama niyama, they are not to be called as Ananda Margis. And even, I repeat, that in English, that supreme command, those who perform sadhana twice a day regularly, the thought of Parampurusha will certainly arise in their minds at the time of death. Their liberation is a sure guarantee. Therefore, every Ananda Margi will have to perform sadhana twice a day invariably. Verily is this the command of the Lord. Without yama and yama, sadhana is an impossibility. Hence the Lord's command is also to follow yama and yama. Disobedience to this command is nothing but to throw oneself into the tortures of human life for crores of years. That no one should undergo torment such as these, that they might be unable to enjoy the eternal blessedness under the loving shelter of the Lord. It is the bounden duty of every Ananda Margi to endeavor to bring all to the path of bliss. Verily is this a part and parcel of sadhana to lead others along the path of righteousness. Shri Shri Anandamurti. Did anybody mention in their verbature or representation that yama and niyama are the fundamentals of yoga? Simply a gymnastic is either in international level or national level. Feel it pity. And the second thing is this. Out of 16 points, everybody, irrespective of old-timer and margi, that means family man, 4 upavasa should be observed. Upavasa also in Sanskrit terminology, upavasa means very near to Paramatman, very near to Paramatman. Whereas fasting in English literature is skipping of meal. It is not like that. That is in Sanskrit is called nirashana, 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 nishana. That means not taking diet. Upavasa means very, very near. Putting end to all worldly activities and coming near to Paramatman is called upavasa. And in general, to follow in worldly level, every Ananda Margi should follow 2 Ekadashis upavasa with water or without water according to the age. And in yogic chikitsa also, renal calculus patients should be provided with the juices of prescribed of Anandamurti in yogic treatment. Likely, 2 upavasas are general ekadashis, one in solar and lunar. And these 2 other Amavasya Purnima for sannyasins, that means old-timers. 4 they have to observe. And in this, when I learned in Ananda Marga Sadhana in 1972 and February 1st, right from then till to this date, I am observing upavasa without water till now, though completed 70 years. At that time, why upavasa? Because I was in college level. When I questioned my acharyas, then they told that Baba explained like this: while you will be on upavasa day without water, what happens, in catabolic and anabolic activities, in catabolic activities, one cell divided, and if the division out of them 2, any part is weak, that will become a dead cell in the body, which will lead to today's contemplation of cancer. Today's contemplation of cancer. And at that time, Anandamurti explained that the live cell will eat away the dead cell and it will become healthy. That is why, while you do not feed your body with routine of diet, then the diet will be for that live cell on that day. That was the observation. And till now, it is a mandatory for Ananda Margis worldwide in 200 countries. And at the same time, whereas the cancer presentation, actually, nobody in first stage comes to Ayurvedic treatment. Only in last stage they start search. But what a wonderful and amazing that Avajji is supporting in yoga system. In yoga system. And he dared to answer Harishji that perfectly I will be ready to present. You feel it proud of Avadeshji being now with us for presentation.
Thank you.
I congratulate and conclude my my submission.
Ramaji, please stay with us because there are one or two questions I want. Hemaji, Hema Shetty, Hemaji, please ask your question to Avdeshji. The question is about the mechanism of decalcification. Hemaji.
Good evening, everyone. Sir, you just now decalcification, various methods where sir was explaining. My only question is like the cause for decalcification, as said, like that it may be age. Still, they're not perfectly known. There are certain assumptions. Just so, how does Shirodhara work, or action mode of action of Shirodhara in decalcification is what my interest is. Because pineal gland, obviously, wherever dhara is being poured, that's the seat of pineal gland. So how is it actually acting, sir? How, if you could just explain me about the samprapti vighatana by Shirodhara, it would be great.
Thank you for the question. Now I will take a meandering answer to your direct question. Why meander? Because it is important for people in Ayurveda. I'm sure they are practicing also, but we are actually doing it live in all our patients. You know the Ashtanga Yoga part, the Yam, the Niyam. By the Yam and Niyam, you stable yourself and then you sit in a tathastha position called Asan. And then you do the Vyayam of Pran. And the next thing to do is Pratyahar. Pratyahar is alternative ahar. That means from the five senses, what you see, there's tasty food, there's tasty this. You don't take anything from outside, you take it from inside. Now, technically speaking, when you are fasting, and fasting means, when I'm saying fasting, I mean either it is water only fasting or water less fasting. These are the only two ways of fasting. There is no third way, please. If somebody says, I'll do it on coconut water, that is not fasting. Because the ultimate goal is we are taking the body into ketosis. The normal cell can go into ketosis, the disease cell will die. That is the process of autophagy. So, whenever we are talking about fasting, we are talking about this. And all this we are doing while we are doing this, all this is decalcifying the pineal gland. Because since I'm a radiologist, the first thing that I do is when the patient gets admitted with us, the first thing is we quantify the calcification of the pineal gland, and we do it every 5 days. So we know exactly how we are decalcifying it and the methods that we are using is working or not. Now coming to the direct question that you asked, how we are able to do it. The known things that are there is Surya Tratak. If in fasting time, when you are into ketosis, when you increase your energies, there are 2-3 ways of increasing the energy. One is by the music that we play. The music is always bhajan. It is Mahamrityunjay Jap. That is what we play. And you are looking at the sun directly. That is Tratak, Surya Tratak. Surya Tratak, that is in the morning. And then if you're sitting in the sun, you are not looking at the sun directly, because many people do not have that, since I can see the sun at any point in time and I won't get any ultraviolet, what these people have been scaring you that, you will get retinal burns and things like that. Yes, first day you might, but if you are trained, you will not get. So that is the second thing that we do. The third thing is, while we are doing Shirodhara, the idea is to instill the energies inside the pineal gland. So that is why we play a certain kind of music and make the patient look at the drops that are falling, so that is the process of dharana, dhyana. And we don't want them to go into samadhi, but that dharan and dhyan, we can do it with a candle also. But since we are doing it in Shirodhara, that is what we are trying to do, so that his external things come to a standstill and we can work internally. I hope I am clear in what I said. Yes, please.
Hema, thank you, Avdeshi. Thank you for your explanation. Hema, any questions? Domaji is very appreciative of your
thank you, sir. Thank you. Thank you, sir.
Hema ji, I have a question for you.
Okay.
You might want to connect with Avdesh ji to discuss this further. And Avdesh ji has already shared his details. I have his details with me. If you would like to connect with Avdesh ji, then please, I'm happy to share Avdesh ji's number here.
Thank you, sir. Thank you. I'll just get in touch with him.
Thank you.
Thank you, sir.
Avdesh ji, I leave it with you to engage with the Ayurveda community, with the yoga community, and to bring this one, to bring the contemporary language into our discourse, which you do very nicely. Number two, in both those instances, both Ayurveda, Yoga, the old Ayush systems, Vedic sciences, is at a different level altogether. You know, it's a hyperdimensional knowledge. It has many, many aspects in that knowledge. And you are right in saying, you know, you shouldn't pull it down to a head-to-head debate. It shouldn't be. But it is important that we don't do that. And you are reminding us again and again, that is not the space. There are many people on the platform. Domaji will agree, Harishji will agree, Agnihotriji will agree, Vishnuji will all agree. But we are delighted that you are being so forceful. That gives us all that extra energy to rethink and reposition our soch, our thinking and thoughts. So I'm happy that you could find a few minutes to join us. Number two, my request, if you could connect with Agnihotriji when you are in Uttarakhand, just to see how we can engage with the All India Institute of Medical Science in Uttarakhand, then that will be wonderful. In terms of today's cancer is on top of the agenda, I have put some points in our chat box about the cancer mission here in Europe. And it's a very extensive, very huge, one of the 5 big missions on the framework program for research, to just look at it, familiarize, so that we can make some connections with our colleagues here in Europe, you know, who will also benefit from these dialogues. The cancer mission for Europe was brought about by the action of one member of the European Parliament, who was the former Prime Minister of Slovenia, Alois Peterle. He's a cancer survivor, and Europe couldn't do anything, but he came to India and he was treated with Ayurveda, and he's still there, healthy and well. So there are people like this who have enabled big policy changes in the European Union, in the Parliament, and we will connect with these kind of people. So today's topic has been extremely important, and we are grateful that people like yourself have joined us. Domaji, thank you so much for your comments. Harishji, thank you for your wonderful comments today. And my deepest respects to our 2 senior Vaidyas, Tapanji and Nagendraji, who clarified many, many points. And I hope these discussions make us a little stronger in our vision for the future. So with those words, I give the floor back to Pavanji. Pavanji.
Tomorrow is also a unique topic, sir.
Tomorrow is also a wonderful topic. And before I give the floor, Pavanji, this is our topic tomorrow, renal stone care and cure. And we can see the 4 people there, Dr. Priyadarshini, Dr. Gajendra from Sioni and from Vadodara, Dr. Kalai and Dr. Mishraji from Varanasi. So, Avdeshi, if you are able to once again be with us in as many of these events as possible, and just, you know, follow what we are discussing to see if we are on the right track, whether we are thinking about these things correctly. The decalcification, Harish ji has a question. Harish ji, namaskar, please.
मेरा एक सजेशन है डॉक्टर अवधेश जी को. मैंने 30-35 साल मॉडर्न डायग्नोसिस एंड आयुर्वेदिक ट्रीटमेंट के फिलॉसफी के ऊपर मैंने प्रैक्टिस की है. बट आफ्टर डूइंग सो मच ऑफ द प्रैक्टिस मैंने रियलाइज किया कि वात पित्त कफ जो आयुर्वेद का बेसिक आधार है, इसको हम छोड़ नहीं सकते हैं. तो अगर अवधेश जी एक एक्सपेरिमेंट करें, ऑलरेडी ये शिरोधारा पे काम कर रहे हैं, अगर एक्सपेरिमेंट करें शिरोधारा का वात पित्त कफ के आधार पे कि वातिक प्रकृति के लोग जो हैं उनको ऑयल के साथ शिरोधारा दी जाए, पैथिक प्रकृति वालों को तक्कर धारा के साथ और कफज वालों को कषाय के साथ शिरोधारा दी जाए, एंड ही विल रियलाइज देयर इज अ चेंज इन द इफेक्ट. दिस इज वन सजेशन. थैंक यू सर. थैंक यू.
अवधेश जी, अगर आपकी तरफ से.
Thank you very much, sir. Thank you very much, and thank you very much for that suggestion. We'll definitely try to do it in a few patients, and we'll come back to you on this, sir. There is one thing which I wanted to. आपने फिर वात पित्त कफ की बात की. One size fits all is modern medicine. 120/80 ब्लड प्रेशर होना चाहिए ना. सपोज अगर किडनी फेलियर का पेशेंट है, जो हम कल ये डिस्कस करने वाले हैं, किडनी स्टोन डिजीज का, अगर सपोज किडनी फेलियर का पेशेंट है, you have not increased the blood pressure, the body has. The body is super intelligent. चेतना का वास है उसमें. आपकी सोच में चेतना का वास है या नहीं है, that can be debatable, लेकिन बॉडी में तो है. बॉडी इज डिवाइन. यत्र पिंडे तत्र ब्रह्मांडे. So the body has increased the blood pressure to actually filter out the toxins. आपने अगर blood pressure कम कर लिया and you feel that the kidneys will not be affected, is high thinking. So Vat, Pitt, Kaph is individualizing a patient to any disease condition that he is having, and this is the best thing that can ever be. So I take it very seriously, sir. आपने जो बोला मैं उसको बहुत seriously लेके I will actually categorize these patients into Vat, Pitt. मुझे ज्यादा आयुर्वेद आता नहीं है मैं, लेकिन नाड़ी देख लेता हूँ, और नाड़ी से वात पित्त कफ कौन सा प्रधान है ये तो कम से कम मैं देख ही लेता हूँ. And we can actually take it forward from there, and I will come back to you on this, sir. Thank you very much for the suggestion. Ji.
Avadhesh ji. In
Yes, sir.
Anandamurti ji's pravachan, there was a reference that 70% of vital energy is derived from the cosmos to every jiva. And only
Yes,
the
sir.
30% is managed by their diet and all those things. Even he referred that you can go to the extent of in tapas, that means tapasya mein तुम 90% तक भी जा सकते हो, 95%. I gave reference also one personality who is still alive in Gujarat area, and his name is Prahlad ji. He is diet free from diet. Since he is 120 years or what they have, everybody, Abdul Kalam visited, and every dignitary visited him. Still
Absolutely.
he is alive. And what?
Absolutely.
And what? Put a question to you, to the people who are therapists of the great Bharat tradition of medicine. That's why I'm very congratulating and grateful to you that being so perfect and in an ambiguous language. I put in my chat box also, in an ambiguous language, you are very forwarding your presentation.
Thank you, sir.
Not to limitalize it to the pages of printing.
Thank you, sir.
That's why I feel it pity.
I would
Who are turning the pages and letters through the lens.
Ji, sir.
I'm keenly observing the people presentation.
Sir, I would like to
books and lines and letters and words and verbiage. You are free in presentation. I feel proud of you.
There we have the best certification for you, Avdesh ji. Dekho, impromptu, aap aaye, or you are here with us for a reason. So I hope you will stay with us in future events also and guide us as we go along. With those few words.
Sir,
please.
One more thing. I would like
Duma
to
ji.
just talk. Aye, Duma ji ke baaton pe. Just give me 1 minute, sir. What he said is absolutely right. In fact, Sunday I am in Kheti Virasat Mission where they are presenting, and there is a it was in 3 parts, how to beat cancer. So third day we are talking about fasting. I would invite everybody to be there in Kheti Virasat Mission. Tune into that. And Kheti Virasat Mission, if you type, you will tune into that. Sunday, 8:30 to 9:30, I'm there talking on fasting, wherein what is the molecular level of what we are saying fasting and how we go about it, how does ketone bodies cure, and how does the what he said a very excellent thing. I will tell you in detail what it is then, but in short, it's like this: 30% of your energies you are getting from the sun, 20% from water, 20% from good relationships, and 30% from food if it is consumable food. Otherwise, if you are taking food that is not consumable, you lose energy. तो खाना खा के ताकत नहीं आती है, नींद आती है. If you look at it, why? Because it is stealing your energy rather than giving energy. So that we will be talking about on Sunday, sir. Thank you.
Avadesh ji. It is sattvic ahara. It is sattvic ahara. Sentient food. Sentient food. It should be for a yoga practitioner or who say a good practitioner of yoga. It should be a sentient. Little for family man, Rajasika. Little for Rajasika to family man, and Tamasika to none. Static
we'll be
food,
talking
that
about
is called static food. That is called static food. And Rajasika is called mutatic food.
We will be talking about that in detail, sir, on Sunday. And we will be comparing this Sattva, Raj and Tam with Brahma, Vishnu, Mahesh. And we will be taking it on further. The Tam is Mahesh, wherein it's a destroyer. So we'll be talking about it on Sunday, sir.
Avadesh ji, those are all Puranic presentations and interpretations. I'm very sorry, because mine is a scientific presentation. Anandamurti's presentation is a scientific presentation. Even in presenting of your chakras also, there are, I'm just very fastly giving that, that Annamaya, sorry, not Kannamaya, Kamamaya, Manomaya, Atimanasamaya, Vijnanamaya, Hiranyamaya Kosha. And these koshas, Pancha Koshatmika, Jaivi, Satta, Kadale, Pushpavat, it is in Ananda Sutram of Anandamurti ji. Pancha Koshatmika, Jaivi, Satta, Kadale, Pushpavat. Like that. These 5 koshas with Jiva. And so many things are there. And where Pranamaya and all these things come into interpretation, it is all actually a traditional and Puranic. And these flexes also, chakras also, and what chakra is, it is in scientific expression of this modern terminology, that is English.
Thank you.
If it is possible, please obtain from website that Anandamarga ideology and all the books presentation by website itself. They have placed actually. You can refer even Ananda Sutram, even idea and ideology, Subhad Sangraha and Ananda Vachanam, all those things where we have gone through them in 1971 only, 72 only. And especially subject that microvita, that should be for the up-to-date of presentation of viruses. Microvita theory of Anandamurti. The book named is Microvita. And in them,
Domaji, thank you. Domaji, thank you very much. We want an extended presentation from you on all of these things. Hamare saath, before I return the floor to Pavanji, The floor is still open. Pavan ji, Sudhakar Reddy ji hai hamare saath. Thoda unse thoda ek do shabd agar. Sudhakar ji, namaskar.
Namaskar, sir.
Namaskar, Sudhakar Reddy ji. You are so happy that you are with us and you are very quiet and you are listening to us. Thoda sa batao ji where we are correct and where we are wrong today.
Namaskar to all dignitaries. Today's presentations were excellent, sir. And there is no comments at all because to comment, I'm not an expert in the treatment protocol of lung cancer. I am a prevention of lung cancer or any cancer also in that bucket. And whatever discussion went on, sir, very nice presentations and scientific background. And especially that what Avdesh sir told regarding the Shirodhara and yoga and chakras and other things. It's actually scientifically, it is true also. Even fasting also, but upavasatin upavasaha. That is very, if you are doing upavasa, we are near to God. So that is actually explained by acharyas. That means if you are not taking food, you are becoming very laghu. Laghu means akasha mahabhuta. So akasha mahabhuta is very always good because it is laghutva. In gurutva is there again the problem comes. So that way our body becomes very laghu and it is become very pure and it reaches to the God. That's what upavasatin upavasaha, are near to abide to God. That is important, sir. Anyway, sir, all the presentations are good and we can prevent any cancer by only following yoga, especially yama niyama. Especially yama niyama. After yama niyama, if you do asana and pranayama, definitely we can. Along with that, in Ayurveda, we have sadvritas. If you follow sadvritas and dinacharya properly, Rutushodhana especially. Rutushodhana, as per the Rutus, if you follow Rutusharya also, that will be giving us to avoid all the free radicals and etc. So that is also important. Dinacharya, Rutusharya, Sadvrita. And one more, lastly, Brahmacharya. That also very, very important in prevention of all these non-communicable diseases, especially cancer, sir. This is my small explanation and other speakers, congratulate them. All they spoke very nicely, sir. Thank you very much for giving this opportunity.
Thank you, Sudharji. You are always important for us because you bring the deep perspectives here. And on my behalf, I congratulate all the speakers, especially our two senior Vaidyas who came early on. And they are a goldmine of information. To have 30,000, 40,000 cases is not is a big resource. And I think, unfortunately, it is not taken out to the world. I think the point that Agnihotriji was trying to say to Tapanji, that is an important point. And I think we are fortunate Avdeshji is here with us. Agnihotriji will tell us a little more. I leave it there because we are following this very carefully. There is a big mission between Government of India and USA, and the National Cancer Institute is involved in some dialogues now with the CCRAS. And I think only part of this experience is captured and presented in these government-to-government dialogues. And I think this is the point that Agnihotriji was trying to get us to, that the people like Tapanji, they have a lot of experience, but they are not part of that mainstream dialogue, which is unfortunate. You know, we need to bring them into the mainstream dialogue for whatever reason. Tapanji says, "Hame degree nahi chahiye, hame award nahi chahiye, theek hai, kaam chal raha." But I think as a nation, we are losing their skills and their experience. So, Pavanji, I leave it there. I leave it to you to take us forward. And thank you so much for tomorrow's event. I hope Avdeshji will join us. Other people will, and he will also bring some more people to the platform. This is our request. People like yourself who are deeply immersed in modern medicine, but are feeling that there is something more in other systems of medicine. I hope you will bring to our platform a few more people like this. Maybe before I go off and give to Pavanji, please, Avdeshji, if you can tell us a little bit about this.
Madanji, don't go off, please, for a while, don't go off, because you are international moderator. We feel it proud of you, being international and a genome scientist. And I ask you, Madanji, what might be the genome of our Avdeshji? in this line, though he is thrown in modern medicine, but having a genome of Ayurvedic system. That is the system of Bharat. Please go through the genome of Avadeshji. And for Avadeshji to hear that the Ashtanga Yoga, though Yama, Niyama, Asana, Pranayama, Pratyahara, Dhyana, Dharana, Samadhi, and the Ashtanga Yoga presented by Patanjali also with two basic principles. One, Chitta Vritti Nirodha Yoga, Nischinto Yoga Yuchyate. These two also are shortcomings. That is why Anandamurti ji gave a sutra, Samyogo Yoga Ityukto, Jivatmaha Paramatmaha. Samyogo Yoga Ityukto, Jivatmaha Paramatmaha. The yoga, which yoga should be termed that Samyogo Yoga Ityukto, Jivatma Paramatma se milne ka hi yoga kaha jata hai. 1 plus 1 should become 1 only. But 1 plus 1 in arithmetic calculation becomes 2. That is algebra or arithmetic and whatever it may be. These foolish people who are the representatives of yoga and having no knowledge of basic principles and at the same time to time upgrading their knowledge and becoming a matter of dustbin, I say. That is why even Samyogo Yoga Ityukto Jivatma Paramatma, when Anandamurti ji gave in Ananda Sutram, it surpassed Patanjali's two shortcomings, that is Chitta Vritti Nirodha Yoga or Nischinto Yoga Yuchyate. Even on these two principles also, if anybody dare to debate, I am ready to debate with them. How they have short fallen. And at the same time, Shankaras also. That is why Anandamurti ji termed that Mithyavadi. Because Jagat, Brahma Satyam, Jagat Mithyaha, his sutra was, that became a failure at his last days. And again, he resorted to bhakti, which is the prominent, actually bhakti is the prominent out of karma and jnana. Bhakti is permanent, which can overrule all these two. That is in Bhagavata, there is a symbolic explanation that a good, healthy lady was sitting with two sons of old age and was asking, please save my two children who are fallen old. And she was quite young enough. The mother was quite young enough. And I think that teenage, but the, her begotten, those two were old reader. Then Bhagavata explains that those two, one is karma and another is jnana. And whereas this lady who was sitting as a virgin, I do not say virgin, whatever it may be, healthy, she is bhakti. This is in Bhagavata, symbolic expression. But people do not observe. So many things are there. What Vyasdeva did, that is why Astadasha Puraneshu Vyasasya Vachanadvayam Paropakara Punyaya Papaya Parapedanam. Why he created 18 Puranas, that means novels, that to teach that Paropakara Punyaya Papaya Parapedanam. Astadasha Puraneshu Vyasasya Vachanadvayam Paropakara Punyaya Papaya Parapedanam. He is the authority of today's Puranic age of this. Actually, this is not the Tantric age, this is not the Vedic age. Now we are living in Puranic age. It is novelistic. Sorry to comment. Thank you.
No, thank you, sir. Thank you, sir. जीव से शिव बनने का योग ही एकमात्र माध्यम है. If you look at all the seers that were there, Gautam Buddha, Vardhaman, Mahavir, all these people, they did the same thing. They did the same thing. They जीवन के युद्ध से बुद्ध कैसे बनते हैं, वो योग की प्रणाली है. जी.
Hari Om. Thank you, Avadeshji. Thank you very much. I think if Pavanji is Pavanji, namaskar. Pavanji,
Madanji, please guarantee me that whether Avadeshji's genome will be tested or not.
We will get.
Because should be. Because those people who have presented from Ayurvedic side also, their genomes also should be tested. Whether they are perfectly right or wrong.
We will clone करेंगे अवधेश जी को थोड़ा करके हर एक राज्य में 20-25 बना के डाल देंगे, हर एक डिस्ट्रिक्ट में डाल देंगे एक, कम से कम एक अवधेशी. Avdeshi, from my side, one last request, please, because you come to Uttarakhand frequently, please let us find a way to engage with the All India Institute Medical Science in Rishikesh. Thoda dialogue बनाए उनके साथ, कुछ भी, whatever it is. If it is to do with खेती, let us do that. मगर वो modern medicine की वो उसके अंदर, whether it is to do with if it is to do with clean food, if it is to do with the biology of the concepts, if it is to do with future physiology, ki physiology is not complete. आगे पढ़ा बहुत physiology.
बहुत है sir, and we are purposefully doing it with IIT Kanpur side. Why? Because if we come from that side,
technology side,
will not be challenged. Otherwise, there are things that will derail the process. So we are coming from that side.
And when you feel the time is correct to open a dialogue with the All India Institute Medical Science,
yes, I will definitely do that.
When you feel the time is correct, because you are already engaging with IIT Log.
Madan ji, for a while. For Avadhesh ji, everything cannot be traced by technology. For reference, I am giving, in border of Sweden and another country, there was research going on very long back itself, that how this Srishti has come, how creation has come into. In that, two groups have divided, one led by lady and another led by gent. And both were researching. And at last they have come to a conclusion that energy and its energy field and the source of energy. And the leader, who was male to a group, then he commented at last that we could find the energy and energy field. And for energy, a subtle particle is there, which is the source to energy. That particle could not be traced. Perhaps in 1965, I think so, that Higgs left this research, and it was in fluid stage only. That is why latestly they have named to that particle as a boson, and related to that boson to Higgs boson. They have interpreted. What this interpretation, and in the same in microatom perspective, Anandamurthy ji, while he conducted in 1979 with a batch of scientists, science-oriented WTs, that means sannyasins, and he explained about microatom theory. In that explanation only, he said perfectly that in a near future, the scientists will develop a sophisticated microscope which can visualize a crude microatom, but subtle microatom cannot be traced by the crude instrument. He himself commented like this. These two commentaries I am telling. In 1960, I think 55, the registration of Anandamarga. After that only, he in one, I cannot name the book because it is banned. That is why I cannot give the title of the book. In that, he said that the human babes will be prepared in human laboratories. That time was not test tube babies. That was not the time of test tube babies. But in his discussion, then only, the title also I cannot name the book's title. And in that, because people searched, intelligence agencies have searched to trace out that book also, but could not, because it was almost all vanished from the field of their trace out. And in that he mentioned that in the near future, the human babes will be prepared in human laboratories. Nobody knew about the test tube babes at that time. For your reference, I am giving.
And at the
same time, I am telling you that whichever theory to conquer the world or the society, they require six factors. One is spiritual philosophy, second is spiritual code, and third is social code and socio-economic theory, and script and preceptor. These six factors should be there to rule or to get into force perfectly, to build a concrete and a well-based society means these 6 factors. Out of these 6, one cult is having 5. That is why that is going to become failure. Only one it is having, it is fulfilling to some extent 5. Thank you very much.
Thank you, Domaji. I have put in the chat box thoda sa vibrational medicine ke baare mein. I've just put 1 or 2 references. I will share that again with Avdesh ji. This has been such an enriching event, extremely amazing discussions. And Avdesh ji, you have opened up some areas where the world wants to go, and it will come from research of the kind that you are offering on vibrational medicine. And
thank you, sir. Thank you, sir. And what Domaji mentioned, the Higgs boson, the God particle, the boson is the Indian guy. Bose is the guy. The Higgs boson particle. That is one thing. The second is प्रेरणा. बहुत सी चीजें प्रेरणा देती है. भारत हमेशा प्रेरणा देता रहेगा, इसीलिए आयुर्वेद हमेशा प्रेरणा देता रहेगा. जितनी भी हीलिंग साइंसेस हैं, they are all pathies. Ayurveda is a way of life.
Avdesh ji, what do you say? Bharata means bhar alta. Bhar alta. In Sanskrit, suffix and prefix and all these things is put. Bhar alta means which feeds physical, psychic and suprapsychic, that is spiritual. That is called Bharata. Our people should become shamed enough, because they should feel that our country is only having 2 interpretations in English terminology, India, and in other than English terminology, that is Bharata. Bharata is a perfect, fitful word to this land, I say. That is why Anandamurti ji never said Indian Ocean. On one occasion, I think he referred that Indian Ocean. He said that Bharat Mahasagar. Bharat Mahasagar. On one occasion only, I heard of his pravachan, out of his pravachan, Indian Ocean. Never he said Indian Ocean, Bharat Mahasagar. Always he said Bharata, Bharata, Bharata. And this connotation, Bharata, Bharata, is also number of times in Bhagavad Gita. Do they not feel shame?
Even in the Rig
changing the name of the land, changing the name of land and part of some this country? Why did not they dare to change the name of this land to Bharata only? Still,
even in the Rig Veda.
Yes, perfectly.
North of the oceans and south of the Himalayas, there is a land called Bharat, and the people are called Bharti.
Exactly, exactly. Feel proud of you. I feel proud of you. And you are acquiring knowledge.
Domaji, thank you so much for keeping us enlightened here about so many important things, and also keeping the energy level very high here. Now, if Pavanji is not here, may I take the liberty of inviting Agnihotri ji to draw this event to a close. Agnihotri ji, namaskar ji. Pavanji आ गया. Pavanji, namaskar.
आज की पूरी जीवंत चर्चा हुई सर, जीवंत.
देखो,
Hats off to all.
अब देखो,
आपका नींद तो डिस्टर्ब नहीं हुआ है ना? आपका नींद के लिए तो डिस्टर्बेंस नहीं हुआ है ना?
आज मैंने इसीलिए संक्षिप्त नहीं बोला.
अग्निहोत्री जी
बहुत होशियार है दादाजी, आप बहुत होशियार हैं.
आदरणीय अग्निहोत्री जी for valedictory remarks. Welcome Agnihotri ji, welcome.
Thank you, sir. Thank you, Dr. Pavan Sharma sir, and thanks our Professor Madan ji. Again, we got a wonderful day today. Our webinar ended to a great level. Before I say anything, I would like to reserve my comments and words in favor of Dr. Avdesh Pandey ji for his revolutionary remarks or words or sentences over the Ayurvedic and yogic knowledge. As to remain him here for coming 5-4 minutes, so that I'm scared, as we started with 24 number and it is only 10. So persons are leaving now, those who are here, they are just speaker is the same and the listener is the same. So let us have this great group remain till end. So paying my regards and respect to Professor Manan sir, Professor V.P. Sharma sir, Professor Jagdish sir Domaji, Professor Ramdas ji, Professor Tapan sir, Dr. Veena Reddy ji, our Swagat ji, Ajaya Erna ji, Dr. Narendra Gujarati ji, our Dr. Hema ji, Dr. Dinesh Das ji, Ved Rajan Patankar ji, Ved Jayesh Thakkar ji, Professor B. Sudhakar Reddy ji, Avdesh Pandey ji, of course, and Dr. Hari Sharma ji, and Dr. Kamni. Professor Kamni was also once she was there. So it's really eye-opening and ear-opening both. We read this Ayurvedic physiology way back in 1974-75, and the way Professor Tapan sir made so clear with the reference of the Vidhi Shonita Adhyay, referring Charak Sutra Adhyay 27-28, Rasaj Vikar, Raktaj Vikar, and Vansaj Vikar, and all that, and their development. Really, word Fufus, from where it could be generated, it is out of the process of from Ras to Mansa, and they labeled it as a lung parenchymal tissue. So the fact is that what was the text of Charak Samhita and Vishnu Samhita, of course, with the Vagbhat or Brihatrayi, Professor Ranjit Rai Desai made great efforts to make these things clear for the Ayurvedic students. And today I got the complete CME over the physiological concept of our development of these organs out of the dhatus. And along with this great treatment part, say 30-40,000 cases of lung cancer with a great expertise hand of using Hirak Bhasm and all that. One thing which he was narrating about the this Kathak or Nirmali seeds, very good. It is the Strychnos potatorum. So I did work over its alcoholic and water decoction over the E. coli. As my work was the water as a water disinfectant, I found that it has got a colony clearing capacity. Apart from that, as people use this poog or supari in pan betel, so the say water soaked small pieces of this seed is also used to use. I think in Assam also, in Varanasi also they used to do. So it has got a very good mucus say extract, some luab that is of the sort. So that can be replaced for those who are habitual of taking this tobacco chewing and all that. So his submission was wonderful, and since he reserves the seat of great guru and pillar, we pay full attention and full respect to him.
Sir,
so was the case.
Can I say something, sir?
Sure.
Regarding the supari that you are saying, if you take fresh, small cut pieces of muleti, fresh muleti, that it will be a good substitute for supari chewers, and that is very good for the whole mouth and the throat also, and the voice also. So that will be a very good substitute. We are doing it, sir.
We were not talking about the use of supari or not. He was talking about the alternative of leaving or the tobacco. Supari is also not good.
That's what, sir. That is what we are doing it. We are doing the same way. We are giving a muleti fresh muleti, not the old one. The fresh ones, they are very sweet also, and the flavor of the mouth, you start because you smell bad. You start
muleti and kulanjan was also used by Didi Lata Didi. It is also very good for the throat also, and it gives a good taste. So that is very good. But for that we have to, if we want to replace that supari or poog, it is wonderful, no doubt. Anyway, so his treatment part was
अग्निहोत्री जी पहले आचार्य का प्रेजेंटेशन जो था निर्मली, उसे तेलुगु में बोलते हैं चिल्ला गिंदलू. पुराने जमाने में वो सुपारी जैसा मुंह में रख करके चबा के खाते थे निर्मली को.
Exactly, people are using in the same manner.
But supari, it is not supari. It is चिल्ला गिंदलू, that is निर्मली.
my Guruji advised me that you go for its water disinfectant action, and since water was not there in wells, there was only mud around the Varanasi area. Then he shifted that if it has got the antiviral antibacterial activity, it might be effective over the E. coli. So E. coli is the commonest cause in our intestine, and it is abundantly found in water also. So we plant in that way. That is another issue. But now I'll come to the second speaker of today. He is Dr. Narendra Gujarati ji. Wonderfully, he talked so many things, and he challenged the protocol of Government of India, WHO or CCRS, that as he told that he never used mask, sanitizer and anything, and he, along with his whole hospital paraphernalia, along with the attendants and all that. I'm sorry, I'm scared that he has never been charged or fined for the same, because it was a compulsion, and apart from the support of keeping himself away from any sort of restriction. But anyway, his courage was great, and his approach. He also told that you just apply oil through the nostrils, not go for the nasya karma along with the dhumpan. Now here comes the preventive aspect of Ayurveda, which we say swasthya. These all tips are there in the Dincharya, as Dr. Professor Reddy talked about earlier. We were giving this nasya or dhumpan or anjan, everything, gandush, kaval, for a healthy person to maintain his health, because we say that these all activities are supposed to do at morning hours where the kapha dosha is prevalent. So if the lung cancer has also been say categorized in the same manner, a person who is fond of it and in habit of observing this nasya karma and this gandush, kaval, even dhumpan, but will do it. And as far as this dhumpan is concerned, our Dhumvarti, Dhumnet and Dhumriyantra is made for the same. The full literature is there. Piyangu, Harenika, Bacha, Gukul, Tagar, Agar, Chandan. These are a few things. Not only it can be made a birthi of it, and it is useful. And not only this, even as the passive smokers effect is concerned, so goes the case that will be observed as the Havan Karma. As I earlier mentioned that in 1999, when there was a Ayurveda Mahotsav in Haridwar, we had a slogan that eat Ayurveda, drink Ayurveda, and inhale only Ayurveda. And where we were having continuous Havan initiated by Swami Ramdev in those days, 1999, and we were distributing the small packing of Chanpas along with the this Havan Samagri, or with the our Ayurvedic drinks also. So the fact is this, that if it is observed in our healthy life, healthy duration, very naturally we can keep ourselves away from so many diseases. So his approach was, as a treatment part of this dhumpan, was really appreciable, and it has got real. He talked about the Nirdosh also from Ahmedabad. So Nirdosh is there, but I also advocated for Nirdosh for those who are having the chain smoker. A very good friend of mine is here. But there was a question in my mind: why should we go for the smoke of that paper which is wrapped over that birthi? That's Nirdosh, because it is not indicated that the paper smoke should be inhaled. So it was not much recommended, though Ahmedabad company came forward with the Nirdosh cigarette, I should say, and I don't know to which extent it's response was there, but it was accepted. And those days it was coming almost 5 rupees, say 10 packing outfit. I don't know whatever it is, but the applicability of dhumpan in the reference of maintaining the avoiding the URTI or upper respiratory tract infection or Urdhjatrugat affiliations, it is most advocated, and so they practically used it and found the benefit of it. Our third presenter was Professor Swagat from Agra. He also underlined these things, and he much talked about the way the Vish Chikitsa or Vidya Chikitsa or Agni Chikitsa is done in that area. So goes the case with the especially working over the lung cancer patients. The always problem is that it is a delayed diagnosis case, or the patients are coming at a later stage. Our Madam Veena Reddy is also came with a very vital data. She narrated for 2 cases, one a 39-year-old female and the other one the 72 years male. She made all things. There was a simple query in my mind that a person who is regularly getting weight loss, she talked about the Shodhan Chikitsa first, but when he referred the reference by maintaining it, because by doing Shodhan or Virechan Karm, the body will get verified and the vitiated pith quantity will be lowered down, then the Rasayan and Bengal Chikitsa will be helpful. So in that way, she really established the justification of her treatment. It is unfortunate that that lady died after a great treatment, but getting away much more benefit out of her treatment. It was a sudden demise out of heart attack. But anyway, and our the good discussion and regularly questions put by Dr. Harish Sharma ji and our Doma sir's presentation, along with our today's Avdesh Pandey ji's presence, that made, rather that ornamented today's webinar. Now I come to the something regarding Dr. Avdesh Pandey ji. Dr. Avdesh Pandey ji, as you have been repeatedly advised and suggested to make a meeting with me whenever you are here in Rishikesh, Dehradun or Haridwar. I don't know what is the hidden fact in Professor Bandhan sir's mind, but what I feel that you may be having modern medicines, science degrees, and having a great knowledge of modern medicine, medicines knowledge, allopathic knowledge, along with your radio diagnosis. But what my impression is that you are no more modern medicine person. You are not only a pro-Ayurvedic person or pro-yoga person, you have completely changed and incarnated as a great advisor of yogic and Ayurvedic sciences in India and whenever you stay. Because you are not speaking, or it is not your strength which making you so speechful. It is the strength of Ayurveda and yoga which is
absolutely.
You are just a speaker of that knowledge which had never been hidden, but it has not been properly advocated. And your voice sounds me like the professor sound of my BHU. They used to, when he used to speak in those days, professors of physics, great physicists, they used to sit on carpet to listen my professors. He was Shambhavi Siddha, and he has gone through the different stages of meditation, of sadhana. There was a corridor gallery where he asked to my photo and art section designer, Mr. Khanna, as I am speaking, I am designing, I am spelling you, describing you, you make it designs. I don't know whether now it is 40 years back. As you dip in Ganges, keep your eye closed. How many colors see inside your, have a one dip and see. So whatever such type of impression, so goes the case with when you are observing the dharana, dhyan, samadhi. Samadhi is entirely, contemplation is entirely the later stage, but in the same way he talked about it. So your speaking just recapitulates me in that manner. So it's really on that day, it was a science day, I was telling that you have got Vigyan from allopathic science, and now you have gone Gyan out of this Ayurveda. Real-tently, may it be Annamaya Kosh, may it be Gyanmaya Kosh, Vigyanmaya Kosh, you are authoritatively talking about. I don't know what is the hidden factor. Your 3 or 4 generation back might be having a great roots with the Indian philosophy, Ayurveda, yoga, and all the Indian culture and civilization. It's not a simple limiting to the Ayurveda itself. So as the time is completing, the fact is this, that you please continue and come forward a little bit more and more. One point is there, when you are doing Sirodhara, whether that oil is not spoiling the face or how you are marrying that when, because if we give the Shirovasti, we put this limitations and we pour that one. But as far as the Shirodhara is concerned, now we have got a very good remedies and tray is there. We are reusing or we are collecting the oils also. So I think you might be having some mechanism over there also, because keeping it is a continuous vibration over a particular part where we suppose that pineal body is there. You may say Agya Chakra, or by giving stimulation to the Agya Chakra, that the things are definitely observing. As Dr. Hema talked about, the fact is this: this calcification is having to which extent? Because you are a radiologist, I don't think that repeatedly on 7th day or even in 1 month you can go for the X-ray, because again it will be a X-ray exposure that is not fair. So it may be better if you go for the blood analysis with the help of any parameter you have taken the first before giving Shirodhara, and then after 15 days interval or so, because we have to have the assessment in the same manner, and your assessment will go a long way for the whole generation of Ayurveda, Yoga and Panchakarma. So you are doing a great service in the terms of Ayurveda, Yoga and making the things available, understandable in a very scientific manner. So I don't want to miss you, and you please remain through my webinars, our webinars, and always in our contact. So kind of you, and you are the great flag holder and torch bearer of our Ayurveda. May God bless you. Thank you. Over to Dr. Pawan Sharma, sir.
Agnihotri ji, for a while, please remain. Okay. And one day I was hearing that in your talk, I do not refer another's name, because she was giving a vehicle for Abrakabasma, Tripala Churna. And if it is given in at least Glycerigia glabra, that is Estu Madhu, it would have been worked much. She also referred that particularly in virus episode and explosion, that she was serving Abrakabasma, I don't know with what putties, but with Tripala Churna. But whereas our brother representative from modern side, he is very particular about even Ankwana also is referring. And I do not know, though they represent and they present that we are representatives from that side. What vehicle they carried, I feel it very shameful. Thank you.
अग्निहोत्री जी, thank you very much. Pawan ji, Avdesh ji, good night. आपके तो 10 बज गया, 10:15 पता नहीं. Pawan ji,
9:15.
चलो.
9:15, not 10:15.
Not 10:15.
Then our Dadaji Joina will become red and face.
He can take his dinner very peacefully and with a very good taste.
Avdesh ji, thank you very much. Greetings. यहाँ आज पूरा रोशनी, यहाँ sunshine. It's 3:45. पौने 4. पवन जी, कल मिले.